Western Asia and the Arab region. Welcome to the second session of the workshop on urban economics and financial recovery in the light of resilience building during this current corona pandemic. It's a second workshop as part of a series which is taking place today. We had one last week already focusing on Asia Pacific and Europe. My name is Katja Schäfer. I'm connecting from Central Europe, in fact, hence good afternoon from my side. I'm working as an interregional advisor with UN Habitat, traditionally based in Nairobi, but now connecting from my home base. Buenos dias to Latin America, to our participants from Latin America, as well as marhaba to our friends and participants from the Arab region. I would like to give you a brief introduction into the basically the proceedings of this workshop, and if our colleagues could actually put the PowerPoint that helps us to remember the different steps would be appreciated. Okay, so this workshop is basically also interpreted as we speak. You can click the small interpretation button at the very bottom of your screen, and we will have translation from Spanish into English and vice versa, from Arabic into English. Unfortunately, for the participants speaking in Spanish, the direct Arabic translation is a challenge, hence so please bear with us, and if there are questions, do not hesitate to reach out to us through the chat box. We also would like to kindly ask all participants to turn off your microphone and or your camera in order to avoid unnecessary background noises. You can also do that at the bottom of the toolbar. If you have questions or would like to ask clarifications for the moderator, speakers and panelists, there is a Q&A box at the bottom of the screen as well. And we kindly encourage you to actively use this means of communication in order for us to follow up. In order to clarify also any technical problem, please do not hesitate to use the chat box. We have Craig and other colleagues sitting there to help you to resolve any of those technical issues. Thank you very much. And I would like to also introduce the participants, the panelists of this workshop. Unfortunately, Christine Knudsen cannot join us, so we have our colleague Esteban Leon, who is the head of the City Resilience Program based in Barcelona from UN Habitat's side as well. We have Tokozile, now a little window is blocking her name, Tokozile Rusvidzo, who is the director of the Gender, Poverty and Social Policy Division at the Economic Commission for Africa. Mr. Hisham El-Helbawi, who is the assistant to the Minister of Local Development, the head of the Local Administration Reform Unit, and the head of the Upper Egypt Local Development Program. We have Ms. Reem Ayadi, the founder and president of the Euro-Mediterranean Economics Association. Mr. Dimitri Pozdiaev, hello Dimitri. He's a global advisor on decentralization and global government finance at the United Nations Capital Development Fund, who will be speaking later on. Ms. Amaya, who is actually a colleague of mine, who will be facilitating some of the interactive sessions during this webinar. Suhaina Al-Nasrawi, who is connecting from Beirut, the social affairs officer focusing on sustainable urban development and also the lead on gender justice, population and inclusive development. Ahlan wa sahlan Suhaina. Mr. Diego Aulistia, the Chief of Human Settlements Unit at the Economic Commission for Latin America and the Caribbean. We also have Ms. Dana Omran, the Managing Director for Africa, the Global Resilient Cities Network. Great to have you on board, as well as Jose Luis Samaniego, the Director of Sustainable Development and Human Settlements at the Economic Commission for Latin America and to the Caribbean. Later on, we will also have discussions from different case studies, and I will introduce the speakers at that moment in time. If I may also take us through the agenda of today before we have our opening sessions. Please, the next slide. In fact, so after the opening remarks, we will have a keynote that introduces basically the topic to all of us on the urban economic resilience discussion and the financial recovery. And then we will have an overview of initial findings on different global practices from the local government perspective. We have a short break where we can stretch our legs, as well as then various city presentations. We have the honor to have Alexandria from Egypt here, the city of Agra in Ghana, Lima, Peru, and Teresina in Brazil. This will be followed, in fact, by a panel discussion or panel dialogue, which I will also moderate. And hopefully, within the period of 3 hours, we will have managed to take us through a very interesting conversation, and the closing remarks will be the end. I'm looking forward to this wonderful afternoon on our side, the morning as well, and would like to invite my colleague Esteban Leon to start the opening remarks session. Thank you.
Thank you, Katia. Good afternoon to all, and buenos días, Latin America. It's a great pleasure to be here. It's a great initiative, I would say, especially considering what we're going through and what's going on in the world.
But I think I'm going to enter as a participant.
Can you hear me? Hello.
Esteban, I can hear you. There was just somebody who I encouraged to switch off or to mute yourself while Esteban is speaking.
Okay, thank you.
Thank you.
No, I was saying it's a great pleasure to be here in this initiative. I think that we are all going through something very special. I would like to think that this is potentially one of the biggest events that's going on in the world at the moment, for this century at least. I was reading how we had in the last century so many kind of iconic moments. One was the Spanish flu, of course, without counting with the First and the Second World War. But in this new century, this is, I think, until now the event, and I hope that it's the last one. But I really think that it's important for us to be gathering here together and discuss some of the experiences that each of the cities are going through. The other thing is, I would like to give a bit of a background on how this came as an initiative, and why we are involved. We have here UN Habitat, UNCDF, and the regional commissions. And I think that this is very important because it's a joint initiative. And the discussion here is about how cities can react and respond and absorb the socioeconomic problems that is bringing COVID-19. And I think that it's important because we are talking about resilience in cities, and about how can we get out in the best possible way of a pandemic as it is this COVID-19. As you might know, UN Habitat is the agency working with very closely with cities. Our mandate, human settlements, is completely related to what is working with cities. And the City Resilience Global Program is one of the programs of UN Habitat that has been working for the last 7-8 years on trying to make sure that we can actually diagnose and provide recommendations for action into cities for multi-hazard for a multi-hazard approach. And well, 7-8 years after we initiated this program, we found ourselves in the middle of this pandemic. And I will say it has been quite important for us because not only because what's going on in the world, but also because it's something that I will, if you asked me 6 months ago, I wouldn't have bet that we are going to be working virtually, that we are going to change so much and drastically the way of working and living in the world. And clearly, I mean, cities have been the most impacted ones on this, or the ones who have most of the influence as well. Our data shows that 90% of COVID cases are coming in cities. And clearly, I mean, more than half of the world's population are living in cities. So basically, it is one of the most important areas or contexts in which we have to work for let's say, absorbing and surviving this crisis. Well, it's natural that we should start working together jointly, because one thing that has been shown during this crisis situation is that we are all in the same boat. Before we had some crises like the Ebola crisis, but it was contained, and it was contained regionally. And we had some other crisis situations or disasters in which it was very, very much localized. But this is something that is affected all countries in the world, and has taken all of us by surprise. And clearly you have some different phases here. One is the immediate response, the health part of the crisis, but the one that it's very pronounced and is coming and is going to stay with us for a while is the socioeconomic part of the crisis. So I think that's something that we must try to not only see how other cities are reacting and responding to it, but also learning from the success of some of the cases, and also, you know, avoiding some of the not much success that some other cases or other cities had. And that's the whole thing about this. I mean, the whole purpose of this meeting and this get together is to try to see how do we show what's good and what's not so good on the response. Another thing that is important to emphasize is that you know, nobody knew and nobody knows how to react. We are all amateurs, let's say, into this crisis. Nobody expected such a large pandemic crisis, and therefore nobody prepared. You can see that some countries are responding in one way, and some others in others. Some countries are more affected. And very much due to the decisions that countries have been taking in the response. So I think that it's important for us, especially in regions that have, you know, large informal settlements, large urban population, and regions where we don't have so much resources as other regions. I think it's highly important to make sure that we, let's say, we nail it. We try to make the best of it, and try to make sure that we respond in a coherent manner. So with these words, I would like to welcome you all to this workshop, this global virtual workshop. I think it's important for us to make sure that we are open, that we discuss these issues about how to support each other. And I think that nowadays, with these global challenges, it's very, very important that at the local level we have some ways to respond and some resources, and at least to learn from each other. So thank you for participating. I can see that we have more than 164 participants. It's quite important. It's quite impressive, and we really look forward to a good discussion and a good workshop. I think that global virtual workshops are going to be very common in the coming months or years probably. But let's not this take the opportunity of us as humans to communicate to each other and to debate and to discuss. And I think this is a good opportunity as well to see that, you know, I mean, if we will have a presential workshop, I don't know if we will have 164 participants involved from all the regions, and it would have been quite difficult and it would have taken much more time and resources to organize. So I think that it's in a way a positive thing that we can have a dialogue among ourselves and basically talk from the many different regions and present the many different experiences from different cities. Thank you, Katia, and welcome all to this global workshop. Over to you.
Thank you, Esteban. I forgot to mention earlier on for the participants from the Arab region, in the interpretation box, unfortunately, Arabic does not show up. And if you don't mind, please select Korean. You will find the Arabic translation there. And I would like to now invite Ms. Tokosile Rosvido, sorry for pronouncing maybe your name not correctly, from the Economic Commission for Africa, to kindly share her opening remarks with us.
Thank you, Katia. Actually, you were very close. It's Ruzito. Togozile Ruzito. Distinguished representatives of local government, experts, participants, colleagues, ladies and gentlemen. Good day to you all and welcome to the Global Workshop on Building Urban Economic Resilience during and after COVID-19, which Katia has already explained to us. As some of you will remember, when the UN Secretary General, Mr. Antonio Guterres, was launching a policy brief on COVID-19 and cities, he specifically said, urban cities are ground zero of COVID-19 pandemic. What COVID-19 demonstrates is that in a predominantly urban world, it is critical and urgent to strengthen how cities anticipate, respond, and recover from future shocks. Given the concentration of people, economic growth, infrastructure, global resilience will depend heavily on urban resilience. Addressing the underlying structural constraints of sustainable cities in both the global north and the global south, including through accelerating progress with SDG 11, has never been more urgent. Today's workshop, and I think Katia did speak to that, aims to share knowledge, experiences, and solutions that can inform ongoing measures to strengthen the recovery of cities from COVID-19 in a manner that ensures long-term resilience. Ladies and gentlemen, the current workshop is part of a global UN project being implemented in 16 cities globally with the objective of supporting local governments in the design and implementation of strategies and plans for economic and financial recovery and resilience. Whilst the pandemic has been multidimensional, whilst the pandemic has had multidimensional impacts in cities, the current workshop focuses on the economic and financial dimensions. I'm being asked to put on my video, sorry. Whilst the pandemic has had multidimensional impacts in cities, the current workshop will focus on the economic and financial dimensions due to four main reasons. One, cities are drivers of national economies, accounting for 80% of the global GDP. With global GDP expected to decline by 4.2 due to COVID-19, it becomes essential to focus on the economic recovery and resilience at the urban scale. Then two, the magnitude of economic impacts in cities in terms of jobs, productivity, and revenues has been particularly severe. Millions of jobs are expected to be lost, with sectors deemed most at risk by ILO, such as accommodation and food services, real estate, manufacturing, wholesale and retail trade, and these are largely urban-based. Third, local governments are first responders during and after the crisis, but they face drastic cuts in their revenues and financing capacities. Their revenues in 2021 are estimated to be 15 to 25% lower, A major hurdle going forward is how to finance COVID-19 recovery in cities under these conditions, while at the same time financing and needing infrastructure and services. A week ago, me and my team actually had a meeting with the mayor of Harare in Zimbabwe, and he expressed how their finances have been hit by COVID-19. Fourth, national stimulus packages are a major instrument for COVID-19 recovery and rebuilding, but require a more deliberate and expanded focus on the urban scale, as well as local government roles and financing needs. Ladies and gentlemen, with these considerations in mind, today's workshop provides a global platform for dialogue and knowledge exchange on COVID-19 crisis, local economic and financial response and recovery measures. It focuses on the key factors and drivers of urban economic and financial resilience, as well as solutions that work in order to inform the actions of local governments and other actors. And clearly, I'm sure when we hear from the representatives of local governments, this is key to them. The workshop, as well as the project within which it falls, are informed by three core principles. First, the scope is expected to go beyond the current COVID-19 crisis by generating knowledge tools and policy instruments that can help cities prepare better for any type of crisis in the future. Whilst this for Africa has not been the first crisis, it has actually been a crisis where we know we have to look across all the borders. Second, why the applicability and scalability of the outcomes of the workshop and the project beyond local action is one of the key priorities that we need to look at. Local action is one of the key priorities of the areas of the UN's Decade for Action to accelerate implementation of the SDGs. Therefore, when we work with local governments, it means we are looking at local action and what happens, especially at city level. We therefore look forward to working with you all through relevant partnerships and collaborative frameworks in the pursuit of resilient cities for a resilient global future. I look forward to fruitful discussion today, discussion that can provide practical learnings to inform COVID action in cities. Thank you.
Thank you very much, Thokozile, and also for stimulating our thinking of relating, in fact, the SDG discussion to the resilience discussion and thinking beyond the current pandemic, but being prepared for future shocks. I would like to invite Mr. Hisham El-Helbawi from Egypt, the assistant to the Minister of Local Development, to also contribute with his opening remarks. Ahlan wa sahlan, Hisham.
مساء الخير. بداية حابب ارحب بيكم في اللقاء ده والمبادرة اللي اعتقد ان هي مهمة جدا وجاية في وقت مهم من عمر العالم ومن فترة تاريخية صعبة بيمر بيها العالم كله، بتمر بيها دول العالم ومدن العالم بصفة خاصة. كمان حابب اقول ان بداية احنا كان عندنا كمدن اختبار صعب جدا لاختبار مرونة المدن دي وقدرتها على التكيف واحتواء أزمة كورونا. ولكن خلينا اقول ان الاحتواء واحتواء الأزمة والتعايش معاها والتكيف معاها مرتبط مش بس ب سياسات مركزية لدول العالم، ولكن كان مرتبط أكتر بقدرة أكبر على اللامركزية للمدن داخل دول العالم المختلفة. وخلينا أقول إن دولة زي مصر وهي اتعودت في الفترات الأخيرة على وجود كتير من المشاكل وكتير من الأزمات بشكل كبير، من أهم سياساتها اللي بتتبعها هو دعم المرونة الكبيرة في إدارة المدن، ويمكن جائحة كورونا بالذات والتعامل معها في مصر إثبات كبير جدا على إننا قد إيه كنا محتاجين لدرجة أكبر من اللامركزية في إدارة المدن. ويمكن التجربة اللي طلعنا بيها تدينا مثال يجاوب على حاجات كتير من الأسئلة اللي المتحدثين اللي قبلي كانوا بيسألوها. هو إحنا محتاجين درجة أكبر من السياسات العامة المركزية اللي ممكن تتبع، ولا محتاجين درجة أكبر من اللامركزية لكل مدينة عشان تقدر تدير أزماتها؟ جائحة كورونا تثبت بلا شك إن اللامركزية محتاجينها بشكل كبير في إدارة المدن، ومحتاجين أكتر إن يكون اللامركزية دي مرتبطة بقدر كبير من حوكمة عملية إدارة التنمية في المدن. ويمكن أنا سعيد إن بعدي هتبقى في كلمات لبعض المدن ومنها اسكندرية اللي هتعرض لكم تجربة مهمة تشير بدرجة كبيرة إلى قد إيه اللامركزية في إدارة المدن، وكمان الابتكار في إدارة المدن كان عامل مهم. فأنا عايز أقول لكم مثلا إن مصر إذا كان عدد حالات الإصابة وصل فيها لحد دلوقتي 100,000 إصابة، 50% منهم أو أكثر من 50% تم تعافوا، و5% حصل لهم حالة وفاة، و5% حصل لهم حالة وفاة. 5% حالة وفاة. فإن أنا لو وزعتهم على محافظات مصر بتحتوي على 27 محافظة، هتجدوا التباين الشديد إن المحافظات الأكثر حضرية هي كانت المحافظات الأكثر إصابة أو بعدد مصابين في فيروس كورونا. فهتلاقوا إن محافظة زي القاهرة، وهي أكبر محافظة في مصر من حيث عدد السكان، كانت أعلى المحافظات في الإصابة. والجيزة تليها الجيزة، تليها اسكندرية، وده الترتيب بتاع عدد لو رتبناهم وفقا للمحافظات الحضرية. فاحنا عندنا 4 محافظات حضرية كاملة بالظبط، ده ترتيبهم في عدد السكان الحضري. إن نفس الترتيب كان ماشي، ففي ارتباط شديد بين المدن والعيش في مدن وما بين كان الإصابة بجائحة كورونا. يمكن أنا بركز على اسكندرية بالذات، لأن اسكندرية كان فيها تجربة رائدة احنا كمان بنتعلم منها دلوقتي. يمكن قبل ما تبتدي التجربة وقبل أول ما بدأ يظهر فيروس كورونا، كان في تحضير لده ما بين القيادة السياسية وما بين المحافظات، أو وزارة التنمية المحلية اللي هي بتشرف على المحافظات، وما بين المحافظات. ويمكن احنا كنا أصعد حالا شوية من بعض الدول الأخرى إن احنا تأخرنا في دخول كورونا لمصر لوقت. ده خلانا نبقى عندنا شوية وقت نعمل خطط مرنة لمواجهة والتكيف مع فيروس كورونا كمان، وإننا نبتدي نفكر إزاي هنقدر نشتغل اقتصاديا وصحيا في الوقت ده. ويمكن كنا بنستفيد جدا من التجارب الحديثة. يعني قدرنا بسرعة يبقى عندنا سيميوليشن موديل توقع الإصابات في الأماكن المختلفة وفي المحافظات المختلفة. ويمكن أدعي أن المحافظات الحضرية في مصر ومنها اسكندرية كان عندها نموذج متوقع لعدد الإصابات اليومية المتوقع خلال فترة كورونا، وكان عندها نموذج هيبقى فين الانتشار. ويمكن استفدنا من حاجات كانت موجودة على منشورة على المواقع المختلفة اللي بتشير إلى الانبعاثات الكربونية عشان نقدر نحدد إيه الأماكن الأكثر عرضة للإصابة. بعد كده كمان كان كل محافظة زي اسكندرية كان عندها خريطة بالGIS لما هو المتوقع، فين متوقع. وده تغير كان عندنا في مصر، إن يبقى عندنا في كل محافظة وفي كل مدينة نظم معلومات جغرافية تقدر تتنبأ بالظواهر المختلفة. ويمكن استفدنا بالدرس ده من كان عندنا أزمة قبلها أو كارثة قبلها، كانت كارثة السيول. فعشان كده كنا بيبقى عندنا نظم توقع لفين ممكن تنتشر الأزمة زي أزمة كورونا. ويمكن اسكندرية ادت نموذج لده، إن كان عندهم توقع قريب جدا من اللي حصل من شهر 3 لحد شهر 7 لعدد الإصابات. يمكن احنا كنا بنشتغل على محورين. محور إدارة الأزمة الصحية والاقتصادية في الوقت بتاع الكورونا، ومحور تاني إن إحنا هنشتغل ما بعد كورونا وتلافي الآثار بتاعتها. يمكن كان في سياسات مركزية بنشتغل بيها أثناء فترة الأزمة. إحنا دايما في فترة الأزمات عندنا في كل محافظة إدارة للأزمات. الإدارة دي موجودة بشكل مباشر، بينضم لها الفئات المتعلقة بنوع المشكلة اللي بتظهر. فمثلا إذا كانت مشكلة صحية بينضم لها ممثل الصحة، وبيبقى هو اللي بيقود أو واحد من قيادات العمل. فاحنا عندنا إدارة للأزمات على مستوى المحافظات، عندنا إدارات لتوقع حجم الأزمة، وبنشتغل كمان على توفير الخدمات الأساسية، وكانت توجيهات للمدن انها تشتغل على التوقعات دي بنفسها وبياناتها. وكمان كان في دعم لتوفير الاحتياجات الأساسية والخدمات، وبالذات في المناطق الأكثر عرضة، وبالذات في المناطق العشوائية لأنها كنا متوقعين فيها الأزمة. ثم مساعدات بقى أو دعم الاقتصاد في الوقت ده، والمساعدات النقدية والعينية اللي تقدم للناس اللي بيتضرروا من الجائحة، وكمان ازاي نقدر نتكيف ونتعايش معاها، وازاي نضع خطة لما بعد كورونا. ولو مريت على دول سريعا، لو مريت على المحاور دي سريعا، فأول محور كان تدعيم دور الأزمات، وحدة الأزمات والكوارث. ويمكن كانوا بيشتغلوا على حاجتين: على تطبيق الإجراءات الاحترازية والالتزام بيها، وعلى تقييم انتشار الفيروس. المحور الثاني اللي كنا بنشتغل عليه أو المحافظات كانت بتشتغل عليه بتنسيق مركزي كان توقع وإدارة الأزمة الصحية. انتوا عارفين إن مصر من الدول اللي البنية الأساسية الصحية بتاعتها مش عالية قوي إنها تقدر تستوعب أزمة زي دي، فكان لازم ندعم القطاع الصحي بشكل كبير، ويبقى عندنا مستشفيات ذات طابع خاص، مستشفيات ميدانية ومستشفيات عزل محددة في كل مدينة. ويمكن ده هتكلمكم عنه الدكتورة جاكلين في اسكندرية، ازاي قدروا يحطوا خطة للمدينة للاحتواء الصحي للمصابين بالفيروس. وده كان مهم جدا عندنا، ويمكن كل مدينة هتلاقوها كانت مختلفة عن الثانية وفقا لطبيعة المدينة وتوقع الأزمة بتاعتها وتوقع حجم المصابين. كان تدخلات الصحية بتختلف من مدينة لأخرى. يمكن إحنا على المستوى المركزي كنا بنقدم كل الدعم المالي، إنما والدعم بالأطقم الطبية بالأدوية، إنما المستوى المحلي هو اللي كان بيحط خطته بنفسه. وهنا أنا عشان كده بدأت بكلمة اللامركزية. هنا كانت اللامركزية مهمة جدا في إدارة أزمة جائحة كورونا. ويمكن أنا متخيل إن بعد جائحة كورونا هتتغير وجهة نظر كتير من القيادات السياسية في تطبيق اللامركزية الكاملة في مصر زي ما بينص عليها الدستور، لأن الجائحة أثبتت بشكل كبير إن الإدارة المحلية قادرة على إنها تستوعب الأزمات وتتعامل معها بخطط أكثر مرونة. فالجائحة فعلا فادتنا في النقطة دي بشكل كبير، إنها خلتنا نثق في مستوى الإدارة المحلية والمستوى الإدارة اللامركزية على مستوى المحافظات. يمكن كان عندنا بيعوزوا دعم مركزي، ففي مجال مثلا ضمان توفير الخدمات الأساسية احنا كنا بننسق مع كل الوزارات عشان ندعم المحافظة بس بالاحتياجات اللي بتطلبها المحافظة. كان في رقابة من المستوى المحلي على الأسواق بشكل كبير خلال فترة الجائحة. كان في ضمان كمان، كان اللي بتواجهنا التخلص من النفايات والمخلفات، ودي كانت مشكلة المستوى المحلي هو اللي قدر يوصل لها بحلول. وكمان كنا بننفذ خطة عامة للتطهير والتعقيم للأماكن العامة، وحطينا كتير من وسائل الوعي عشان ضمان التباعد الاجتماعي. في مجال دعم الفئات الضعيفة وتوفير الخدمات الأساسية، في الحقيقة إن إحنا كان عندنا تجربة كتير رائدة في إن إحنا إزاي على المستوى المحلي كمان يقدروا يبقى عندهم الآليات ليصلوا للفئات الفقيرة والفئات اللي اللي كانت اكثر عرضه للاضرار الاقتصاديه في المدن. ويمكن تجربه اسكندريه برضو ازاي حصروا الناس اللي الانفورمال سيكتور، الناس القطاع غير الرسمي، ازاي تم حصره، وازاي قدروا يوصلوا له، وازاي قدروا كمان يوفروا له المساعدات في الوقت اللازم. ده كان تجربه مهمه واحنا بنشتغل عليها دلوقتي. فزي ما كان زمان التعامل مع الازمات مركزي، في الحقيقه ما كانش بيجيب نتيجه، قد ايه التعامل اللامركزي كان مهم. ويمكن ساعدنا ده كمان في ان احنا نطلع بطرق مختلفه، ان تقبل الحكومه ان يكون في طرق مختلفه لتقديم الدعم والخدمات. الدول زي مصر كان دايما في سياسه عامه هي اللي بتوجه تقديم الخدمات والمساعدات. لاول مره دلوقتي ان كل محافظه بيبقى ليها آلية مختلفه في تقديم ده بدعم من الحكومه المركزيه. فده كمان كان حاجه مهمه جدا في الفتره دي. كمان بالنسبه للتعامل مع الازمه من ناحيه الاداره، كمان كان فيها دروس كبيره، لان جزء كبير من المتطوعين والشباب انضموا للاداره المحليه ودعموها في ده. فده كانت حاجه مفيده جدا في الفتره دي. اللي عايز اقوله قبل ما انهي الجزء ده من كلمتي، ان احنا خرجنا من المشكله دي بان احنا لازم نثق اكتر في قيادات وفي الاداره المحليه للتنميه، لان هم الاقرب للمشكله، هم اللي ايديهم في المشكله، هم اللي يقدروا يساعدوا على حلها. ويمكن كان دعم كبير من الاداره المركزيه بس بدون تدخل بالحلول، وده كان مهم في المرحله دي. احنا دلوقتي بنحاول نشتغل مع المدن على انهم يكون عندهم خطه تعافي بقى، وخطه اصحاح اقتصادي ما بعد الكورونا. ويمكن في فتره كورونا احنا عندنا المحافظات دلوقتي بقت بتقدم الخدمات كلها اونلاين. في 42 خدمه كانوا بيقدموا اونلاين، احنا ما كانش عندنا خدمات اونلاين بتقدم. دلوقتي الحكومات المحليه عندهم بيقدموا معظم خدماتهم اونلاين. دلوقتي الاداره المحليه كل مدينه بتحاول انها تحط خطه للتعافي والاصحاح الاقتصادي، معتمد على مشروعات كثيفه العماله دلوقتي شغالين عليها بشكل كبير، معتمد على قروض للمشروعات الصغيره، معتمد على اننا بندعم الكلاسترز والتكتلات الاقتصاديه لدرجه ان احنا بنقدم الدعم المادي حاليا، معتمد كمان على سياسات مختلفة في التمويل وفي تقديم الدعم الفني من الحكومة. ففي الحقيقة إن التجربة اللي هتعرضها الدكتورة جاكلين في نائب محافظ اسكندرية هتوري لكم قد إيه إن حالياً وإحنا بنحط خطة مع كل الأطراف بدعم من اليون هابيتات لخطة تعافي من آثار كورونا، بالتعاون ما بين القطاع الخاص والقطاع الغير الحكومي او القطاع المنظمات غير الحكوميه والحكومه، هيدعم وجود خطه تنميه اقتصاديه حقيقيه في محافظه اسكندريه مع كل الدعم من المستوى المركزي لده. في الحقيقه دي انا حبيت اشارك معاكم ده بس كخبره مرينا بيها ولسه بنشتغل فيها، وان شاء الله في المناقشات نقدر نقول ايه اللي ممكن تقدروا تساعدونا، ايه اللي ممكن نعمله وننقله من تجارب تانية ناجحه في دول العالم المختلفه. وبشكركم شكرا جزيلا.
شكرا for the presentation from Egypt. Very informative, very interesting, and I actually very much enjoyed how you emphasized the link between resilience, planning for resilience, and then placing the most vulnerable communities right at the center, and also by addressing actually potential capacity gaps that local governments might have in even helping to formalize the informal and bringing them into the economic direction that contributes also further to strengthening decentralized processes in the cities that you mentioned. You also highlighted the case of Alexandria, which takes me actually to the next speaker, the keynote speech by Ms. Reem Ayadi, the head of the European Mediterranean Economists Association. Dear Reem, welcome, and you are invited to present your keynote. Thanks a lot.
Good afternoon, everybody. Do you hear me well? And do you see my presentation?
We can hear you and we can see your presentation.
I wanted to slideshow. Okay. First of all, thank you very much for inviting me to provide this keynote speech on this very important topic, which is building the urban economic resilience during and after the COVID-19. First of all, listening very carefully to what I heard, I must say that the COVID-19, it has been an external shock at the beginning, which later on transformed itself into an endogenous social and economic shock, which had implication on our socio-economic models over this period of time. So I must say that three very important conditions that we need to think of is that this external shock is global, is uncertain, is generalized, and in fact, it has led to a fundamental supply and demand shock. So in fact, we have seen, for example, that even the response function, the policy response function of many countries have been very diverse. Some countries that have been prepared first to this type of external shock in general have been probably more prepared than others because of their financial capacity and the prior financial capacity. But others who did not have this financial capacity suffered more during not only the crisis management, but also in their planning for recovery. And this, what I call inequality of the policy responses and the level of economic preparedness over time, this has been really a very deep weakness, in fact, in what we think of a global crisis as we have it today. So that's why there has been very important calls from many organizations to have a solidaire and a global response over time. So in my speech, I will cover three points. One is a TRIS development model, economic model, which in fact we developed it prior to the COVID crisis. But then during the COVID crisis, we have developed the pillars for economic and financial resilience. And then third, I will dive into urban resilience and applying this resilient TRIS model. So I will try to use my screen. So just let me know. Do you see the next slide, please?
Perfectly well.
Okay,
perfectly
perfect.
well.
So I will start with what we call the TRIS development model. That is really, when we started developing it, we thought it will shape the future for the Euro-Mediterranean and Africa. So it was really original work that we have developed, and we had also the financial support by the European Union. Now, the TRIS is an acronym for the guiding principles that should drive our economic development model in this specific aspects that we are talking about. First is transparency, to build really trust based on a greater accountability of past, present decisions, actions, and intention. This is extremely important to have transparent governance. Second, responsibility is also to manage, in reality, the possible intended and unintended consequences in the future and reflect on their ethical acceptability. So it's really pushing our humanity to live responsibly, not only the citizens, but also all the economic actors and social actors that are there. Third is inclusiveness. It's a model that is inclusive, which really take into account what is societally desirable for the current generation. So no one has to be left behind. Rural areas, or for example, vulnerable population, informal economy, and so on. So it has to be inclusive. Third, sustainable, which in fact to take care of what is left for future generation. And of course, the aspect related to sustainable energy and environment are in the heart of the construction. Now, this TRIS model really offer a response for very important aspects, which are the prosperity paradox. I've seen over time, there has been this global context where there is globalization, digitalization, automation, also now a global pandemic, blockchain, revolutions, pan-industrialization, but all of these are risks to the economy that must be taken into consideration, and then thinking about for this future that we would like to have going forward. So for example, if we look at the digital age, it's really bringing to us limitless possibilities for innovation, economic progress, but also has stagnated our wage and youth employment over the years. But also inequality has increased dramatically over the years. But also our TRIS model, this is what we are trying to develop, is to also will cope with acceleration of the new science, technologies, and discoveries. Which will in fact have wide and potentially disruptive impacts on our society, and also can serve in fact as a model for resilience during external shocks like what we have today over the last 6 months of the global pandemic. So the idea of this TRIS development model really is to develop or to rethink the framework and institutions around work and employment to address inequalities and injustice within the societies that we have been seeing over the years. Now, what we are trying here to do is also to take into account the global transitions, which would either lead to a conservative future, which we call it the H1 future, or the transformative future. Now, for example, with the global pandemic, we are moving very fast into this transformative future. So, and it's in 4 dimensions, 4 global transitions that we are developing here. The green transition, so we're moving really from an extractive, acquisitive resources to a circular way to use energy and natural resources. Economic transition is from a dominant capitalism, or corporate capitalism, to more distributed, inclusive capitalism, to more really different types of inclusion and distribution. And this is really in line with what I heard before for the case of Egypt, really decentralized economic models that are really developing the country, not only 1 or 2 cities. The third is societal transition from addicted induced consumption. We've seen it in reality in some cases when the global pandemic started. In some countries, there has been a herd onto supermarket for people to overconsume, afraid of there will be no supplies of food. But this is really because of the addiction and the inducement of consumption that we have been living through over the years, to a more responsible forms of consumptions and lifestyles in general. And for the governance transition, in fact, it's from a top-down approach to a more democratic, cooperative, and horizontal types of governance that are built on transparency. So this model in reality, if you see it here, it's very much aligned with the UN SDGs, which in fact now we're trying to think how we could really link it with the specific indicators to allow measurability of those indicators. So now this is really the framework that we have developed. Now moving into resilience. So how to make this TRIS development economic model resilient? In reality, as you can see here, and it's, of course, I have only a few minutes to present this, which the product of many years of work. When applying this TRIS model, we have done it already for example, in the case of Lebanon, right before the explosion. And we've seen that there has been some elements or challenges that will have serious implications for the country itself. And I think I would really encourage you to read that paper, because it's really good application of what we're talking about here. So when applying the TRIS model to a real context, the idea is to deliver a responsible innovation strategy, which is embedded in the policy roadmap as a result of a short, medium-term foresight and backcasting analysis. So the outcome here is to have what I call the responsible innovation strategy for a trustworthy governance, climate neutral investment, inclusive economic progress, including citizen empowerment, inclusive innovation, and value sharing measures that enable responsible citizens' behaviors, fostering what the model that we are talking about, the TRIS transition model. Now, moving a bit further, the thinking here is what can, or how can the TRIS development model be a resilient one? And this is a discussion we have made during the pandemic in reality. Resilience, it's in fact a historical word. It's a Latin word of, as you can see it here, which means a jump back and rebound. So what we need to do is to ensure that the capacity of a system to recover from adversity and to rebound from this external shock that we are talking about. So two main dimensions of shocks that determine how the system responds to them are intensity and persistence, as you can see it here. This variable determines, in fact, the intensity of the response needed. So the response has to be intense, well thought, for the system to bounce back and to absorb, in fact, the change when the shock is not limited, and to adapt to the change when the shock is significant but not disruptive, and to transform the system itself when the shock is disruptive. And the pandemic of COVID-19 has been quite transformative, because the shock has been disruptive, not only from a behavioral point of view, but also from a socioeconomic point of view. And this is why it's a time to accelerate this change into different type of development models. Sorry, okay, here we go. Next slide. So how to do it in practice? And I think many countries have tried to do this. So first, 3 channels from the extreme stress conditions that we're talking about, so pandemics or any other external shocks. We need to develop these 3 pillars. The early warning systems to prevent, measure the risks, and prepare for the optimal policy responses. So in terms of the how, this pandemic is not so different from other major crises that our humanity passed through. The second pillar is crisis management system, which has to be effective to manage this risk. To be effective, it needs to be prepared in advance and really ensure that the money is there to be able to manage the crisis when it occurs. This is important. So what we call, you see, there are the concept of resilience. So you need to have buffers to be able to resist or to respond to the crisis. The third pillar is recovery adaptation system. How your system is you're rebounding back, how it is really moving into what I call a long-term future that is wanted by everybody. Now I would like to dive in the few minutes I left into this cities, you know, and urban economic resilience. How all of this will have to be applied to urban resilience. Now, of course, many cities have faced historically extreme conditions. As you can see here, this is Venice in the 1600s, where it has been severely affected by Black Death, pandemia, and many deaths as well. So, for resilient cities to evolve, they need to be prepared to face those shocks. And it has happened in the past also. I mean, this is not yet another shock that we need to move on. And then to ensure those that policy responses are really responding to the well-being and inclusiveness above all. And then, as I mentioned before, the 3 pillars, they have to be applied. So looking at the 4 principles I mentioned, what have we done in the crisis management? So transparency has been there. Of course, there are differences between countries. I mean, for example, on the level of testing, on the level of, how to respond and which type of data, whether the data has been complete or not. But overall, there has been data, and the citizens have been very much informed about this, the magnitude of the crisis. And as you can see here, for example, some of the biggest cities have been very much hit by the pandemic. So we can also think why this has been the case, because simply there is some research that shows that there is an interaction between urban lack of resilience, for example, and then the density of the population. The second point is responsibility. So citizens' awareness raising for preventing sanitary measures, for example. I mean, the masks have been available to everybody and so on, and people have been quite, in reality, responsible for managing this situation over time. Also inclusiveness. I've seen many measures that have been, for example, in Europe, have been really trying not to leave anybody behind. But then this is more in the countries that have social safety net, not all the other countries, for example, which did not have this safety net. But also we need to also think that the way the answer has been designed, in some countries, this was not necessarily there. And then, of course, the level of sustainability to enhance over time the reduction and impact of the reduction of impacts and environment protection over time in terms of, for example, tourism, mobility, consumption, and so on. Now, in terms of urban resilience, so how to for this pandemic to become a transformative scenario for it to develop in a certain way over the years. One very important report by the OECD is showing that the increased capacity for responding to a negative event with a transformative and creative way generating positive outcomes. So how to move into really generating those positive outcomes and in a creative manner. And this is the role, in fact, of what I call creative thinking, but also research and development, and how to manage this in an open, accessible way. And that is why, as I said, a global solution here is very important. For example, if we take the case of the social physical distancing, of course, this is an important measure that has been used as a crisis management situation over the planet. But then this might lead us to think to a transformative approach, which is really space adaptation in the cities, and see the crisis as an opportunity to promote changes for the better. This is also something that needs to be probably thought in many of the cities, for example, in Europe, or also in the South Mediterranean, and also probably in Africa, where, but of course here the spaces is the constraint, and it needs to be managed based on the countries we are talking about. The second thing is that one of the key characteristics of the pandemic, of the COVID-19, is it is transmitted very easily and is also staying on surfaces. So it is important here to develop some thinking and develop some research and development here for have innovative materials that are really dealing with this specificity of the virus. And this also leads to more hygienic measures and cleaning measures that can stay there over time. And this is also a kind of a buffer to ensure that those cities are prepared for future pandemic over time. And then in terms of the lockdown, of course, we've seen that, for example, the digital practices have been quite an opportunity for the countries that have already developed their own systems, a digital system and infrastructures. So in terms of e-schooling, smart working, healthcare online, urban services as well. And I think we heard it also in the case of Egypt that this has happened. Also, in terms of the uncertainty of lockdowns, probably this is also something that needs to be thought in terms of the community spaces that will be used, and also adapting completely the architecture and exploring new spaces for leisure and for, you know, interacting over time. So not to leave things at last minute. Also in terms of the resources supply, I mean, in terms of food supply, for example, self-production mechanisms, urban gardening, and other sharing systems that could really help us to transform our systems into what we call a more resilient urban systems in the region. And we will continue our research on this topic with you. And I hope if you have questions, please do not hesitate. Thank you very much.
Thank you very much, Reem, and for your very inspiring keynote speech. I have to say you took us from your very own context, which is actually a community that is very resilient, and we are sending all our best regards, in fact, to Beirut and to the Mediterranean region. What I specifically found very interesting is the link of the social and governance dynamic in relation to actually inspiring a greener economic recovery aspect here. And the examples you have already chosen were really eye-opening and inspiring, in fact, and also looking, I think for many of the participants, that could be something, you know, to take to their own contexts already and see how that could be embedded. We have had, in fact, a lot of inputs so far, and we would like to move actually to a more interactive session now. Thank you, Reem. And I hand over to my colleague Amaya, or no, to Anna, I don't know who will actually take this on, to take us through a Mentimeter exercise where we will try to understand who the participants are, and over to my colleagues.
So thank you, Katya, and good day to everyone. After those enlightening speeches from our opening and keynote speakers, we would like to get to know just a little bit more about the other participants, so the attendees, and through this Mentimeter interactive sessions, and as well as provide you a means for sharing with us your views on the different topics that we will be discussing throughout the day. So I would like to invite you to go to the menti.com website on your device and input the code written above. I cannot see it with my screen, but it is on the top portion of the screen. And please leave this website open. We will be having several of these throughout the session. And so, okay, let's begin. First, okay, there. Okay, so first, we would like to know which region are you from? So it seems like we are having a bit of a balance between the different regions today. A lot from Latin America. I know it's quite early in the morning there in some portions. Some from the Arab regions, Europe, some from Africa. And also from Asia Pacific, one person, hello. And it's nice to see that all regions are represented, and that we will learn a bit more from these from different regions of the world. Last session we also had presentations from focused on Asia Pacific and Europe, and today we'll have presentations focused on Latin America, Arab, and Africa. Okay, next we have another question about the participants. So which sector are you affiliated with? So we have local government, other government levels, international organization, academia, NGOs or CSOs, private sector, and others. So again, it's great to see how the different sectors are represented today. A lot from international organizations, being that we are all partners in the UN in this event, and many from the private sector, I can see in academia as well. Great. Okay, so let's move on to the next question. So Next, how familiar are you with the concept of urban economic resilience? Before the start of this workshop, how much do you already know about it? So that we can, oh, okay, why is the voting closed? Sorry about that. Okay, I'm not sure why the voting is closed for this question. Let me see, open voting, there you go. Okay, so let's give this 30 seconds. So please vote on how familiar are you with the concept of urban economic resilience. Okay, so it's great to see that there's a bit of familiarity. I think this is more or less where we were also at during last session. We had around 3 to 4 in the scale as well. And definitely this will inform our speakers on the on how deep the knowledge base of the participants are. And next, what are you most interested to learn about in today's session? So please type whatever things you would like to learn about in today's session, and we will take this into consideration when we are doing the discussion. And I would also urge the participants to please, if you have any questions, type it in the question and answer box. We will either directly answer this or answer this in a live manner later on. And over to you, Katya, for the next part of the talk. I will leave this all open for another minute or so that you can have time to type your responses. Thank you so much.
Thank you very much, Anna. We are already a little bit behind time, so I'll keep my moderation brief and immediately invite our colleague from UNCDF to in fact, Dimitri, give us a conceptual framework introduction on urban economic resilience. Over to you, Dimitri, please.
Thank you so much, Katya, and welcome, colleagues. It's a pleasure to be with you today. Let me activate my share screen with you. I hope you can see the screen.
Perfectly well.
Excellent, excellent. You may even see me. So we have been talking about urban economic resilience today, and we've had some interesting examples covering both the practical and the theoretical aspects of urban economic resilience. But to be able to proceed with this particular program, and as was presented in the beginning, this program will work with 15-16 partner cities to help them develop their urban economic resilience and recovery strategies and plans. We need to unpack the concept of urban economic resilience. The way we did it in consultation with our partners was to come with the definition of an urban economic resilience as the capacity and related capabilities of urban communities. Why we are talking about capacities and capabilities? Because it's not only important to have a capacity, and our colleague from Alexandria mentioned the need for progressive decentralization, which is essentially a capacity to be able to do something, but it's also important that urban communities have the capability, the actual know-how and the skills to implement certain actions. And of course, we are talking about this capacity and related capabilities in the context of negative shocks, including long-term stresses to their economies. Those capacities and related capabilities are in two major areas. It is planning, reallocation and mobilization of resources with the objective to withstand such negative shocks, recover from them, and rebuild at least to the pre-crisis level, while having in mind kind of a futuristic dimension of recovery, and our colleague from the Economist Association spoke about it, and that future is, of course, sustainable and green city that can help place local economies on the path of sustainable and diversified economic growth. Whereas we are talking about that sustainable future and the performance of local economies, we have in mind primarily three indicators. This is stable gross city product growth per capita without any shocks, very precipitous declines, or unexplained spikes, as may be the case. It is a stable or even increasing own source revenue growth. It is stable and increasing labor force participation rates. And last but not least, declining inequality rates. We believe that if these indicators are in place, this is an evidence of a healthy economic development and growth of urban communities, which actually is a testimony to their adequate resilience. We have come up as a result of our discussions with a four-aspect model of urban economic resilience. And to some extent, it resembles what our colleague from the Mediterranean Economist Association presented. Those four aspects are business environment, labor market, financial environment, and economic governance. And these four aspects or dimensions create a system of urban economy that covers the major factors of production, as well as the governance dimension that eventually determines the allocation of those factors. Of course, I will not go through all the indicators of urban economic resilience, but some of them have already been mentioned, like, for example, economic informality, which is definitely an indicator of resilience. It is supply chains. And one thing that this COVID-19 crisis has brought to light was the fragility of global supply chains and the high degree of dependency of many urban economies of such value chains. So when we indicate those factors, we should also ask ourselves questions. What can be changed and how? Talking about supply chains, can we improve the reliance on local supply chains? Can we increase the use of local resources? How can we leverage local markets, and so on and so forth? Talking about informality, and our colleague from Alexandria has mentioned it. What can be done to support the informal sector, to help its continuous functioning, while at the same time extending the benefits of formalization, and so on and so forth. Now, you will see some principles of building urban economic I believe, sorry, I have inadvertently muted myself, but hopefully not much was lost. I'm talking now about the principles of building urban economic resilience. There are some general principles as well as some more specific principles. The general principles involve prioritization, efficiency, the entrepreneurial state, as well as fighting corruption and waste. I would like to elaborate a little bit on the entrepreneurial state principle. The United Nations agencies and our partners working on this project are great believers in an entrepreneurial state. Another thing that COVID-19 has demonstrated is the danger of having a weak, small government. It has been, in many cases, a big failure of a small government that COVID-19 has exposed. So an able and competent urban government, which not only facilitates the market forces, but actually participates, actually directs local development, is an absolutely critical factor for ensuring local economic development and local resilience. There are also specific principles, and probably the most important of them is learning lessons from the crisis, and there are several such lessons. One of them is income and wealth inequality, because another thing that has been revealed by COVID-19 is that the crisis affects unequally people with different income and non-income status. And it primarily and particularly badly hits people with low incomes, with low access to services, and so on and so forth. And this, of course, undermines urban resilience. And if we want to improve that, we need to be true to the principle of leaving no one behind, which is the guiding principle for the SDG agenda. And we should be able to identify such pockets of exclusion and work from various directions to ensure that people in those pockets improve their situation and access to the sources of income and non-income benefits. Thank you so much for your attention, and over to you, Katya.
Thank you very much, Dimitri. We lost you for a short while, but we didn't lose much of the content. I would like to actually go straight to the next session and just wanted to confirm, Amaya, are you there?
Yes, I'm here.
Thank you very much. Then, Amaya, over to you to give us a brief overview over global practices for the local economic recovery and resilience building discussion. Thank you.
Thanks. We are going to share screen.
It is here. Thank you very much.
Thanks. Thanks to everybody. I am Amaya Zelaya from UN Habitat, and will give a brief overview of global practices collected for local economic recovery and resilience building. It's important to explain that we are working in the first phase of a project that luckily will have at least 3. Of course, we have this questionnaire that some of you already know. We are today immersed in the second of these global virtual workshops we are running this August with the first initial findings. The questionnaire will be open till middle September. So we invite all the cities that could be joining us today to fill in the questionnaire. And we will have a global compendium of practices that will be a working and live document thought to pave the way for lessons learned and further training and advices to be given as for the future of cities in crisis that will come luckily in October. We have around 20 cities that have completed the survey. You can see the names in this list, but and we have the survey in Arabic, English, Russian, and Spanish. So it's open for a lot of people to join and to fill the survey. As for primary and secondary cities, with the survey complete, you can see that we have around 30% of cities that are secondary and 70% of cities that are primary. And you can see the statistics and the graphic of activity that clearly shows that activity has been increasing. And this is one of the reasons why we decided to open the survey till mid-September so far. What the survey is about? It's only 14 questions. And it's very important for us to explain that we try to make it very easy with a combination of narrative and explanatory answers and other ones that need more accurate data and multiple choice selection to be able to extract some basic statistics that you are going to see today. We are asking about crisis timeline, challenges that cities could be facing, impacts of this crisis, of course, organized through the skeleton and backbone that UNCDF have provided. So labor markets, business environment, financial environment, and economic governance arrangements. We are very, very interested in the role of local government in the crisis management and the coordination among actors, if they have, and their contributions, no matter if they are coming from public sector, private sector, or others. We are asking about the specific examples coming from public sector or other local stakeholders. And when it comes to measures, mid to long-term recovery measures, as we in UN Habitat, we are asking about alignment with the urban agenda principles, which means that we are asking about if the measures are aligned with leaving no one behind, ensuring sustainable and inclusive urban economies, and of course with ensuring environmental sustainability. UNCDF has already talked about main and important aspects of urban economic resilience. From UN Habitat, we need to highlight that for us, urban resilience is something measurable from a systemic way of thinking, that we count not only on citizens, but on all the inhabitants in the urban settings, that we are always talking about continuity and operations maintenance through all shocks and stresses, and that any action we could be thinking of as for a city must ensure sustainability and transform our environment for the better. About concrete questions we are asking in the survey, even from the ones that are narrative and explanatory, we can have some statistics. And according to the results, around 55% of cities did not have any emergency response plan in place. In some regions, there is a lack of timely response for the most vulnerable. And most of the cities are now developing economic reanimation plans, counting on innovative sources of finance together with citizens, businesses, and organizations. Question 6, about the contribution of local government, central government, and local private stakeholders, is telling us that as for labor markets, is central government and all partners that are coming from answers in 40 and around 40%. But when it comes to business environment, financial environment, and economic governance arrangements, you can see that is central government who has the main role. For local government, business continuity, and key public services delivery is local government. And when it comes to labor markets, 95% of answers is telling us that it's about regulation of working conditions in compliance with COVID-19 health requirements, and 90% of I think we are not in the right. Yes, thanks. And 90% of answers is telling us that it's about dissemination of relevant health information to workers. Sorry. When it comes to business environment, 95% of answers are talking us about maintenance and disinfection of public spaces, streets, public squares, municipal markets, etc. And 81% is talking about relief measures for businesses. About financial environment, 60% of questions or answers are telling us about the role of local government to support and promotion mobile money digital financial translations, and also collection of related data. That is precisely what we are doing through this questionnaire. And when it comes to economic governance arrangement, 77% of questions are telling us about the establishment of institutional structures to manage the economic impacts and accelerate recovery through specialized committees, platforms, and mechanisms for information sharing, awareness raising, and dialogue with citizens. As for local government business continuity, adequate fiscal space, and uninterrupted delivery of key public services, 86% of answers are talking us about the provision of PPIs and adequate health conditions for municipal staff, and the restructuring of existing services to reduce health risk and minimize physical contact. 90% of answers are talking us about the reprioritization and reprogramming of existing municipal budgets to increase availability of finance in areas that are critical for COVID. About the answers related with the alignment with the new urban agenda, if we go from strongly disagree in blue dark to strongly agree in light green, we have received quite positive answers about leaving no one behind, more positive than negative at least. Same with ensure sustainable and inclusive urban economies, and same with environmental sustainability. About the general dynamics of the survey, we invite all the cities that could be with us today, as I have already explained, to join and fill the questionnaire, because as you have seen, not all the questions or the surveys we have are complete yet. And we are waiting at least for these 6 cities, but we hope more of you want to join us. And join us not only in the questionnaire, but in next workshops, training models, and further compendium of practices. So we are waiting for you, and thanks.
Thank you, Amaya. And thanks for being so brief. I think we caught up with time. And I think we are all, you know, looking forward to the break, but I would like to ask Anna to take us through yet another Mentimeter exercise, which looks at the economic impacts actually at the city level triggered by the COVID-19 situation. Anna, over to you.
Thank you so much again, Katja. Just to recap on the answers that we got from what participants are most interested in, and I think a lot of them are talking about the case studies. So after the break, we will be having 4 cities sharing with us their experiences. But before that, let's move on to the next parts of the interactive session. Let me go to the next question. Okay. And so for the second part, first, we would like to know, after hearing about the conceptual framework of urban resilience, and then the global, the current project we have in collecting global practices in different cities. So what do you think are some of the most pressing economic impacts of COVID-19 in your city? So again, please access menti.com website, and using the code and share with us the information that you, the impacts that you believe is most pressing in your city. Okay, so immediately we have unemployment as highlight. Interestingly enough, it is also a highlight from from the first session we had. And then we have other impacts such as healthcare, social security. Okay, things are moving pretty fast. Poverty, and still unemployment is the biggest and most prominent. And I think, again, this was also the same highlight that in the word map that was from the previous ones. business closures, job loss. Let's see. Okay, and we're getting more and more answers. Education. Yes, education is actually a big issue now that I think a lot of people are losing access to education facilities, and definitely a lot of the yes. Okay, so okay, the word map has now been closed. Thank you so much for participating. Great, so let's move on to the next questions. After hearing about these 4 different categories, labor markets, business environment, and financial environment and economic governance arrangement, how satisfied are you about your own city's interventions in the following areas? So again, please rate whether you are not at all satisfied or extremely satisfied. Okay, similarly to last session as well, it's in the lower end of the spectrum, meaning that there is a lot more that we can do to improve the interventions of cities in these following areas. The lowest ones seems to be the financial environment. We do know that a lot of cities are struggling to, in terms of their revenues. Okay, voting has been closed. Thank you so much. Next. Finally, we have the last question before we go on our break. What are some priority actions that you think could improve the economic resilience of your city in the light of COVID-19 experiences? So I'll give you 1 minute to answer this question. Again, please put some keywords that you think are priority actions in improving the economic resilience of your city in the light of COVID-19. So in the previous, yes, so marketing, crisis management, knowledge sharing, supporting small businesses. So there, again, a lot of this is involved in jobs, in knowledge sharing, education. Interestingly enough, that's a big highlight that we didn't see from last session, which was focusing more on employment as a priority action. Okay, so voting has been closed. Thank you very much for participating in our interactive session, our second interactive session. So I think now I will hand it back to Katya, who will call for our coffee.
Yes, thank you very much, Anna. And this is a very good introduction to having a bit of a physical and mental break from the previous inputs we have had. I would invite you to have a glass of water, have a little walk in your vicinity, and we'll see you back in 6 minutes. It is 4:40 my Central European time. I will switch off the microphone and my video, but would at the same time also encourage the 160 participants that we are still having in this call to basically ask questions in the Q&A section if you feel like having direct questions. Unfortunately, we don't have time to have a direct response to it, but the panelists and others are answering your questions as we speak. So have a enjoyable short break, and we see you back in 5.5 minutes. So it is 4:40 Central European time, and we are back to the second part of this workshop. The afternoon will be interactive as well, or the morning in Latin America. We will have 4 city presentations as well as discussion afterwards with different representatives from the regions attending this workshop. I herewith would like to invite the representatives from the various cities to start this journey across the world with their respective city representations. We have the deputy governor of the city of Alexandria in Egypt, Ms. Jacqueline Azer. We have Ms. Patricia Talavera Chaparro, the manager of the economic development for the municipality of Lima in Peru. We have Mr. Moses Kwarashi, who is the Chief Investments and Business Development Officer at the Metropolitan Assembly in the city of Accra in Ghana. And we have Mrs. Gabriela Uchoa from Brazil, who is representing the city of Teresina, and she is the Corporation Director there. I'm sorry if I might have mispronounced your names. It was not with a bad intention, but I would like to start with Ms. Jacqueline Azer and the case study of Alexandria. I would like to invite you also to be brief and maybe focus your presentation to 7 to 8 minutes so that we try to keep the overall workshop time to the previously indicated time. Thank you very much. Ms. Jacqueline, over to you.
Good evening, everybody. I'll try to focus my presentation as much as I can.
Would you have a video so we can enjoy seeing you as well?
Yeah, I'm
you.
sharing my video.
Okay. Perfect. Okay. Here you are. We have you.
Okay. I want to share my presentation. That's it.
And here we have your screen.
Okay.
It's there. Perfect.
It's my pleasure to present you today the case study of Alexandria, Egypt regarding building urban economic resilience during and after COVID-19. We will go through the following items: city location and profile, brief description of COVID-19 crisis in the city, main economic and financial impacts, crisis response, examples of local response and recovery measures, mid to long-term economic recovery plan. Alexandria is one of the ancient cities in the world. It was founded by Alexander the Great around 331 before Christ. It is in the north of Egypt on the Mediterranean Sea. Alexandria population is approximately 6 million, of which 23% in the working age group and 10% are unemployed. The city economic contribution value is the third in Egypt, representing 8% of the total gross national product, and has the country's main port, which accounts alone for 55% of total Egypt foreign trade. And Alexandria is the major industrial city, with nearly 40% of total Egypt manufacturing output. A brief description of COVID-19 crisis in the city. The city was highly responsive during the crisis since its early warning signs. The timeline showed the developments. Applying the general plan of public events was carried out on the 10th of March, while the first positive case in the city was detected on the 13th of March. From 14th to 16th of March, suspension of all nurseries, schools, universities, and the flight in the international airport was carried out. On the 17th of March, a set of measures was implemented to reduce the workforce in the administrative units. On the 19th of March, a partial lockdown starting from 7 p.m. till 6 a.m. was carried out. On the 22nd of March, Support Daily Worker Initiative was launched in Alexandria to provide food aid to casual workers who are badly hit by the lockdown measures. On the 2nd of April, the governor of Alexandria formed a crisis management committee headed by the deputy governor. On the 24th of June, the curfew was cancelled and the public facilities were reopened according to precautionary guidelines. The main economic and financial impacts in the city On the labor markets, in Alexandria, hundreds of workers who depend on daily wages were out of jobs since the start of the lockdown. The mainly affected sectors were hospitality, casual workers, artisanal workers, and people working in the hotel and tourism sector. On the national level, the Central Agency for Public Mobilization and Statistics estimate that 62% of the total workers have been affected negatively in their jobs due to the COVID-19 crisis, and 26% lost their jobs. Regarding the impact on the business environment, registration of the new companies was declined by 56%, while the new commercial business licenses was declined by 28% for the same period. Regarding the financial environment, revenues of the city from the public beaches was plunged by 82%, while the revenues of the parking lot and toll stations declined by 64%, and revenues of other properties leased by the city declined at least by 37%. The city financial allocation from the central government was normally allocated in the beginning of the fiscal year on the 1st of July, while budgetary allocation within the city was carried out for efficient use of resources, and many of the supplies and equipment was provided directly from the central government to help combating the viral epidemic. The crisis response within the city included crisis management strategy and engagement of local government and other stakeholders, as well as facing the challenges in the implementation process. The crisis management strategy within Alexandria City composed of 4 main pillars. The first pillar was training and increasing awareness of training of 500 trainees from the Health Directorate on the preventive measures, printing brochures and posters containing information regarding the preventive measure to be followed by the public, and publishing the preventive measure on all local electronic platforms. The second pillar include launching initiatives for fundraising and the provision of medical supplies through donations from the private sector and NGO. The third pillar included continuous sanitization of all city districts, all local governmental buildings, as well as the public facilities. The fourth and the most important pillar was institutionalizing the crisis management efforts. Through a committee chaired by the Deputy Governor, the committee performed the following tasks: assessment of the current situation and designing a response plan, ensuring the full preparation of the university and youth hostels to receive positive cases in an important translation of the decentralization concept, launching an interactive GIS map as demonstrated in this slide, including all hospitals, public health facilities, showing admission capacity, human and physical resources available, in order to be able to admit and distribute cases based on logistic models. Regarding the role of the local government and other stakeholders, all stakeholders, including central government, local government, NGOs, and private sector, were effectively coordinating and working in harmony to streamline all efforts, measures, and initiatives targeting to respond and mitigate the negative effects of the crisis. Regarding challenges in the implementation, the major challenges were ambiguity of the situation and difficulty to predict the progress of the epidemic. And this was mitigated by developing a mathematical model specific for the city to forecast the number of cases, including the best and worst case scenario as illustrated in this slide. Additionally, continuous communication among stakeholders was maintained through open channel, which facilitated the exchange of data and allowed for timely action from the local authority. Regarding the local response and recovery measures, the local government ensured the readiness of the health services of the city to provide relevant health care for COVID-19 patients without disrupting the health care system of the city through preparation of 2 hospitals at the start of March 2020, which reached 10 hospitals by the end of this month. A database with all cases was built and updated frequently according to the reported cases and information available. All persons in contact with positive cases are given treatment and PPE package and are instructed to self-isolate at home for 14 days, starting from the day of the index case. Coordination was done with the Red Crescent staff as volunteers within the health directorate. Additionally, the role of the local government included launching the Support Daily Worker initiatives, which provided food rations for 100,040 beneficiaries, and launching Your Support Equals Life initiative for providing medical equipment to the health facility. Both initiatives are still focusing on the community needs. Regarding the Chamber of Commerce, it provided financial support to the most vulnerable business owners and coordinated with authorities to facilitate the implementation of measures announced by the Central Bank of Egypt to defer interest payment for 6 months. And regarding Alexandria Business Association, ABA responded immediately to the crisis with program for food supplies. It is also the city's largest microfinance lender, which in a timely manner responded to the crisis through supporting the daily workers, streamlining and facilitating the terms of microfinance. Finally, the mid to long-term economic recovery plan included several areas of interventions, such as precautionary measures before the complete reopening of the administrative building, such as assessment of the quality of the infrastructure, improving the service level, commitment to health precautions such as sanitization, social distancing, using the PPE, monitoring of the employee health status, and installing a glass windows over the counters offering services to the clients. These responses and recovery measures of the city have prioritized the following principles of the new urban agenda: leave no one behind, ensure sustainable and inclusive urban economy, ensure environmental sustainability. Thank you.
Thank you, Jacqueline, for your very interesting local representation of the challenges you have faced and how you try to address them. And I found it quite interesting, actually, at the beginning also how you emphasized the large increase in unemployment, as well as you know, the decline actually of local revenue for the city, and in fact the measures that were taken later on also to address support to the most vulnerable, the daily workers, looking at you know, microfinance support and so on. And I would encourage participants to ask questions directly to Jacqueline so that she can respond in the question and answer section. Thank you very much for Jacqueline for your time, and greetings to Alexandria. And we are traveling now from Egypt, from Alexandria, located in the north of Africa, in the Arab region, to the west of Africa, to the city of Accra, where I would like to invite Moses from the Metropolitan Accra Assembly to present the case study from the city. Moses, over to you.
Thank you very much, Sefa. Thank you, colleagues and other partners that are gathered here. COVID-19 obviously is not one of the normal, crises that the city of Accra has faced. Obviously, its impact has been very severe in terms of affecting our overall economic bottom line. I mean, it is not the first time Accra is facing a crisis. Accra had previously faced some crises. You know, Accra is prone to flooding, and in 2015, for instance, there was major flooding in Accra that created a major disaster leading to destruction of properties, public facilities, markets, and that became a very big issue. But Accra was able to work its way out of that. Apart from that, we could also recall Accra facing an incidence of cholera between 2014 and 2015 that became very severe, killing almost over 200 people. But Accra managed to come out with a very solid public health measures to deal with that. Accra obviously is an old city, has always been a very vibrant city, one of the biggest cities in Ghana. Obviously, it hosts both governments and major private installations. It is where the politics of Ghana occurred, and it is where we have all the major infrastructures that keep the country moving. COVID obviously impacted us very severely, as I have said. Obviously, if you look at the national growth being projected, you could see a very sharp decline in that. The first reported incidence of COVID was on 12 March 2020. That was cases which were imported into Accra. Thereafter, we have seen a surge, not to the level that we've seen in other Western countries, but still very worrying. about 42,000 cases so far, and half of all those cases are incidents that are reported in Accra. Accra obviously had worked hard to ensure that it is managing those cases very successfully, because as you can see in the numbers, the fatality rate is very low. Even though it is regrettable, we have a total number of about 231 persons dying from COVID. We still face challenge with daily testings because there's a need to have more daily testings. That is very critical. There's a need to also have continued support for those who have been affected by COVID-19 and ensure that any stigma that are attached to it are far removed. And then also, we also have a very daunting task of ensuring that everyone complied with the safety protocols that we have put in place to ensure the safety of the entire residents of Accra. Now, I have been in many webinars, forums, and I've engaged with many cities across the world, and we seem to have similar problems. We have COVID has exacerbated and had amplified the number of vulnerables that are living within our cities, and Accra is no exception. We've seen vast number of individuals, becoming vulnerable and definitely needing some sort of assistance and protection. And it is very critical that Accra doing what it does best to ensure that we support these vulnerable through this crisis and ensure that they are able to be reintegrated into the mainstream economy at some point in the near future. What we could see also is that COVID had actually impacted on the local assembly as well. I mean, everywhere you see declining revenue. As we speak right now, Accra is facing a shortfall of over 1.7 million budgetary shortfalls. That obviously would impact on our services, definitely will impact on our responses. Now, in terms of the major economic models framework, that determines how we could measure the impact of the COVID on our economic environment. Clearly, we could see that businesses are suffering with record decline in sales, which is also affecting employment. We can also see that surveys which was conducted by the Ghana Statistical Survey showing that businesses anticipate 25% decline in economic activity and 14% decline in employment in the worst case scenario. Businesses are also reporting major impact on their cash flows. And this obviously, it is arising out of declining sales and the fact that banking and financial institutions are trying to tighten lending conditions in order to protect themselves from creating more bad assets. In terms of the economic governance, what we could see is that there had been some level of trade-offs where we had to focus more in terms of economic decisions on areas that provide relief to the vulnerables, and then also ensure that the city had an emergency response team that is able to generate resources to support the budget and activities that we are doing overall to provide relief from COVID. Then also, COVID is a major disaster, and that has alerted the city to activate its disaster management units to ensure that it is in collaboration with the national disaster organizations providing the needed reliefs that are needed to the people who require them most. Now, our major response initially was to realize that COVID would have impact on the local economy. 70% of our populations work within the local economy. And if those class of persons do not have assets to be able to be part of economic activity, that could have very serious wealth degrading impact on the city. So the city had to take measures initially to ensure that the markets are protected, the local economy are protected. We conduct extensive mitigation and cleanup of all our markets, where most of our residents work to make sure that it is shielded from COVID. We have also worked with draft of policies, including mandatory wearing of face masks, and provide sanitary resources around those of public spaces, just to ensure that people are complying with the protocols that we've provided, and that they are not exposing themselves and others to the risk of COVID contraction. The local authority is the main responder to crisis, and we have the responsibility of ensuring a better coordination among all the stakeholders that are working to ensure that we are able to defeat COVID. Among the major stakeholders that we work with and collaborate with is the Ghana Health Service, that is leading the government charge in terms of public health, management of the cases. The Ghana Health Service works closely with the Metro Health Unit to ensure that the cases of COVID are managed right from inception until the very end, whether there's a successful discharge of COVID patients, or the barrier of any casualties that may have occurred. And as part of the response, what we did was to shut down schools. That is part of the national response to the COVID-19 crisis, and there is an ongoing assessment of when those schools could come back. We, as a local authority, had taken measures to ensure that most of those schools are fumigated, including the public sector had avoided a complete shutdown because government, noting very well that COVID could be a major problem, has invested heavily into remote working resources. The government smart workplace solutions had allowed a lot of public offices, including our own offices, to be decongested and ensure that people can work from safe locations and are able to provide the needed services which is required. It is also very instructive to know that private sector has become a very key stakeholder in the fight against COVID by forming, by instigating a private sector fund, which is investing heavily into construction of health facilities, and then also are arranging support for other businesses that would have, problems with, COVID. Now, addressing the issue of COVID, it cannot be the business as usual. And it can't be the business as usual because COVID has had very significant psychological impact on everybody across the world. And it is that fear which had held back major economic activity. Obviously, we need, and Ghana is working, Accra, city of Accra and Ghana is working to ensure greater urban resilience by, helping people to understand, empowering our citizens to understand that we could still be able to do our activities, ensure that we are observing the necessary protocols, and at the same time, keeping ourselves safe from contracting COVID. It is only by doing so that we'll be able to move on as a city. But then, key to the city's long-term planning, medium to long-term planning, is ensuring that, the vast numbers of the vulnerable groups that have been laid off or out of work as a result of the impact of COVID have generated skills that are worth creating and that supports the city agenda of growth in the long term. That is very critical. And the city obviously is looking at skills, massive skills development as a way of, helping and empowering people out of COVID. We also know very well that, entrepreneurial skills and entrepreneurial potential are very critical in keeping our economic growth resilient. So obviously, the city would look at ensuring that there is some attention to entrepreneurial growth. And we're going to do that not on our own, in conjunction with departments and central governments to ensure that both, micro, medium and small scale enterprises are able to have access to funding, skills development, and then the necessary partnerships in order to be able to flourish post-COVID. We will also focus on our greening initiative. COVID obviously helped us to understand how beautiful our world would be if we are able to improve on air quality around. And during the period where there were less activity within the city, we saw substantial improvements in the air quality. Obviously, we cannot, in our efforts to build comprehensively and economy in the near future, that there is a need for us to invest into the environment. So the city's greening initiatives is something that we still and do it in collaboration with all stakeholders and partners. We will also invest in revenue collections because it is very stage that as a city, we are able to remain resilient in collection of revenue to be able to provide all the services that are required. There's a lot that we need to do. Clearly, most cities do not have the resources that they need in order to be able to provide the services that is required of them and to be able to implement those long-term economic plans. So it's something that is always becoming very problematic, and we're trying to work solutions around it by ensuring that our system of revenue collection is very robust and is able to generate the necessary funding that can fund, the necessary revenue that can fund our recovery. I'd like to thank you all for listening to my presentation, and it is a pleasure to be here. Thank you very much.
Thank you, Moses. Thanks so much for giving your short insights from Accra and actually from the local authorities' perspective, emphasizing, not only the coordination and the response, but also the financing challenge that comes along and the kind of partnerships that you have to look for and necessary skills, in fact, that you have identified that should be built. I think it's a very stimulating case study. Please be available for questions in the Q&A section. I think there will be a lot of requests also to you. Thanks a lot, Moses. And we are heading westbound to Brazil, to the city of Teresina. I would like to ask Gabriela Uchoa to present the case from Teresina. Thank you.
Hi. I was cannot to share my presentation.
The video is working, so that is
okay. Yes,
perfect. And your case study is here as well.
Okay, thank you very much. And can you go on? Next, Anna. No? Okay, so I am Gabriela Uchoa. I'm from Teresina, the city in Brazil. Is the state capital of Piauí, a semi-arid region in the Brazilian Northeast. As you can see on our location. The metropolitan Teresina is a metropolitan region of 1.2 million inhabitants. It's a relatively poor area of Brazil. It's the second poorest state, and have a GDP per capita about $6,000. Now it's even less with the currency going down, but despite that, we are regional reference for health and also educational services in this area of Brazil. Next. So the city is a regional hub for health services. The city, according to the last studies from this for last year in Brazil, and the city is the main hub for services for more than 200 cities. Indeed, this is the city in Brazil that receives more people regularly from other cities in the whole country, and raised many concerns about how we could contain the spread of the disease in the city and also serve the patients from other states, since 60% of the occupancy or no hospital normally are from cities from other region. In the municipal hospitals, it's not like the state national hospitals, and these numbers are from the local hospitals at all. So even for basic services, we have in the second image, many other cities, people from other cities coming to Teresina also. You can next, Anna. So the way the crisis unfolds in the city, we started in 17th of March with the first confirmed case in the city. So the next day, the municipality declared the state of public emergency. And some days later, we started the state of public calamity and the closure of all non-essential activities. It was quite effective in comparison to other Brazilian capitals. It containing the spread of the disease. And if you look to the numbers in Teresina and the numbers of other capitals or similar cities in Teresina or similar cities in Brazil, you would see that the containment of the cases was quite low in comparison, especially to the two other close capitals in the region. So Brazil nowadays have more than 100,000 cases. It's one of the main hotspots now for the epidemic. The city, by the beginning of August, has 14,000 cases. Now it's 15,000 cases, I guess. And we have about 742 lives that we lost during this pandemic. So in April, in the beginning of April, the city started implemented this COVID crisis committee that was responsible for all the emergency response in the city and all of the services that we need to reprogram and reconvert and etc. In the 3rd July, Teresina started the reopening of economic activities. It was the last capital in Brazil to start reopening, but we did not feel we are prepared for reopening right now the activities, as cases in Brazil are still going higher. Following this 4 phases reopening strategy, we start also the Teresina Ativa program. That's a program for supporting economic recovery in the city. Next. So the municipality took the leadership in the crisis response. It was the local government who defined the regulations for limiting the economic activities, the flows of goods, of people, the normatives for the essential operations to avoid public agglomerations, to ensure health and public safety. We have normative measures for the public spaces, for the services, etc. As Brazil is a federative system of governance, the municipality has these competencies for regulating these services. So also the municipality we have this emergency aid program from the national government for all of the people that had losses, all the autonomous that lost their incomes, and also for the companies, and to support jobs. And in addition to that, the municipality also have this program with all of the families receiving the food baskets. Also, all of the families from with children in the public schools are also receiving food baskets from the municipality. The municipality was responsible for building 3 new field hospitals in the city and to expand the number of UCI beds and etc. The adaptation of the basic health network and to organize and to expand the access to health in the city, and also sewage and sanitation infrastructure and informal settlements. And also the local government has this protagonist role in the campaigns and communications to intensify health surveillance and containing the spread of the virus. We had many tension in this relationship between the different levels of government, as in Brazil. We have different strategies in different levels. We had a quite good conversation with the state level, but national level, many cities had this issue because the national government are not supporting these measures for social isolation or for closing non-essential activities. So Teresina is also one of the cities taking the lead in the National Municipalities Association to demand more consistency from the national government, and also to release higher budgets for the municipalities to deal with the measures, the response measures to this crisis. And also it was very important for planning the activities in the city. It was a weekly serological survey that the municipality started to conduct since the beginning of the crisis with all neighborhoods. So we did this serological survey by sampling of the population on all of the neighborhoods, going in different households to monitor the progress of diseases, also in non-symptomatic cases. Next. And there are these mitigation measures in comparison, as I said, in comparison with other capitals, it was relatively efficiency, but it has a price. So from January to May, we count a loss of about almost 8,000 formal workers. And if you compare the same periods of previous year, it was less 3,000 jobs. We are already facing economic crisis in Brazil with rising unemployment rate. So this crisis came to affect the economy even harder. The revenues they fell about 22% in April, 14% in May. The main national transfer for the municipalities also decreased by 7.9%. And even the national emergency, even receiving these national emergency funds now, the total revenues for the municipality are expected to decrease by 6% this year. And with all the expenses increasing now, so with the crisis response. Next. So this is how are the increases in the local government expenses. So we managed to keep the expense control in the last years, but you can see in the beginning of the crisis and from March to May, we have this spike on the local government expenses. Next, Anna. Thanks. So these crises also bring crisis moments. They also bring learnings for now, for us. So this in Brazil, we have a really strong financial crisis from 2015, 2018. It pushed about 6% of Brazilian cities to deficit. Almost all capitals in Brazil went to deficit, with some capitals went to bankruptcy. But the city of Teresina managed to bounce back better after this crisis. We had this comprehensive program to evaluate the public expenses, the revenues, and to cope with the financial crisis some years ago that worked quite well. So we could manage to have superávit, like we have savings, even if this crisis moment, and the municipality had this financial health to cope with the crisis now, and also to know how to act in these moments to respond to this the financial crisis derived from COVID crisis. Next. So this program now is redirecting this its effort towards reprioritization and reprogramming of the existing municipal budgets to increase the availability of financial in critical areas that are critical for COVID response recovery, and also restructuring their own resources of finance to mobilize additional resources. So the good thing is that there are opportunities to reduce costs by increasing the efficiency of the consumption of resources. That is also good when you think about climate mitigation and adaptation. So we are already in this program years ago start implementing some projects to reduce energy consumption, to increase energy efficiency, to increase water efficiency, water consumption efficiency, and tackling some inefficiencies in some services like garbage collection, drainage systems, etc. And this proved really effective to reducing expenses and having a better use of the financial resources. And in this moment, it's even more important that we push this change towards sustainability and efficiency of resources, and having in mind climate mitigation and climate adaptation. Next. This crisis also hardly affected the local business, the local economy. The municipality work with this local business and cooperatives to reconvert local activities to supply the city with the necessary health and sanitation goods. And also through the local Teresina People's Bank, that is a way to translate it, but it's not exactly his name, but we offered this 1 million in reals to as microcredit finance to the micro and small business, and also suspended the payments for taxes and fees. And this was not like without tensions. We have many challenges dealing with formal and informal sectors, like not only how to respond differently to this both of the sectors, but between the two sectors itself. So we still have to manage these tensions between formal and informal sectors, not only in law enforcing with these new measures that we need to comply with, but also how we can support them in this crisis. Next. And but one thing that we are concerned about is that the severe economic impacts of this crisis are yet to be seen and to be measured. The economy has managed to survive mainly because you have this injection of income through the national emergency aid that covered almost 40% of the city population were receiving the national income aid. That is about 75% of the minimum wage. And in total, we have about $500 million of reals directed to Teresina through this emergency aid from April to July. And also the support of the national government to the business and the larger business and companies to pay for 75% of the jobs. So we're expected to see many jobs still to disappear, many companies to be closed. And we are seeing that with the end of this national emergency aid in September, we may have the real figures of the economic impact and the business closure. Next. So we need to prepare for this mid and long term. So since August, we started this program together with the organized civil society that's called Teresina Ativa. And the aim of this program is to provide institutional and technical support to the mapped economic sectors of the city that are being negatively affected by the pandemic, and to try together to find ways for the city recovery. So the main objectives of this program is to have this institutional articulation to support local companies, to support for companies in identifying credit solutions. So you have many representatives with not only from the civil society or the municipality, but also from the financial institutions, and to support the development of new products, services, and administrative strategies, and to develop partnerships to support research and technological innovations to this market. And next. And that's it. Thanks for the attention of everyone. Thanks also for the invitation. I tried to be as brief as possible. We had also other challenges that's not there that we are seeing for the future also, that to maintain some public services that are essential, and for cities in developing countries like Teresina, they are going to face the same problem, especially the public transportation is going to be a huge matter for not only mobility, but for the economy itself. And also we had to see how it's going to change the city, the flows of people, of goods, and etc. in the city, and how we can maintain the service operating in a satisfactory way. And also education is a major concern for the city, as the great part of the population still does not want the kids to go back to school. That's it. Thank you very much. I'm sorry if I took too much of your time, and yes, I'm available to any questions. Thanks.
Thank you, Gabriela. Thanks so much. I actually took out a few elements from your presentation, which I enjoyed a lot, which is basically putting the cities in Brazil in a dialogue with the national government, because, you know, as we know, cities are carrying the brunt of the load, and using the National Municipal Association is actually, you know, also a vehicle to raise this awareness. And at the same time, I also enjoyed, you know, the let's say the Brazilian way of going local, looking at the local budget and how you can actually maintain it and strengthen this while being a little bit less dependent, let's say, or because maybe there is not sufficient funds coming from the national level, and how that can be actually discussed, you know, and locally discussed, but also raising the awareness, I think, with the national government on what kind of sources of additional support might be available. Thanks a lot again, Gabriela, and I would like to move now to Lima. I'm not really sure who will represent the Lima case study. I was given a name of Patricia Talavero Chaparro, but it might be also another person. Please make yourself known to the group.
Buenos días con todos, los saluda Patricia Talavera, soy gerente de Desarrollo Económico de la Municipalidad de Lima y les voy a presentar el caso de estudio Lima, Perú. El Perú tiene 31.2 millones de habitantes. De esos 31, el 30% de la población está asentada en la ciudad de Lima. Lima se organiza de manera territorial en 43 distritos. Cada uno de estos distritos está representado por un alcalde, pero la Municipalidad de Lima Metropolitana tiene carácter provincial. Es la municipalidad más grande y representa a todos los distritos, a los 43 distritos. La población, como ustedes pueden ver en la diapositiva, está casi pareja. Un 49% son hombres y un 51% son mujeres. Tenemos el desagregado de cómo está la composición de acuerdo a los segmentos socioeconómicos. Y ahí ustedes pueden observar que en la mayor población está concentrada en los segmentos socioeconómicos C y D. Tenemos el 45% y el 22%. ¿Qué quiere decir esto? Que la mayor población que está concentrada en estos segmentos, sus compras las realizan en efectivo y van a diario al mercado de abastos. La siguiente diapositiva, por favor. Ahora podemos observar en la siguiente diapositiva cómo estamos en Lima Metropolitana con respecto al COVID. Ahí ustedes pueden observar la data, los indicadores de pruebas rápidas, los positivos asintomáticos, el número de fallecidos, el porcentaje de letalidad y cuántas muestras hemos hecho. Y un dato sumamente importante es qué porcentaje de casos positivos tenemos, y el mayor porcentaje, como pueden ver, el 49% está en Lima, de los cuales el 70% de los fallecidos es adulto mayor. Esto nos da un indicador bastante interesante para explicar las siguientes diapositivas. La siguiente, por favor. Frente a esta situación, nos enfrentamos a muchos desafíos, como por ejemplo, se pusieron sobre el tapete, en vitrina, muchas de las debilidades que teníamos en nuestro país, como por ejemplo que solamente el 4% de nuestro PBI estaba destinado a la salud, con lo cual había una limitada cobertura hospitalaria. Teníamos ya el 70% de la economía informal. Y acá hay un dato interesante. Hasta enero de este año teníamos el índice de desempleo de 4%, que iba fluctuando entre 4 a 6%. Sin embargo, a julio de este año tenemos un poquito más de 16%, con lo cual en Lima Metropolitana tenemos cerca de 2 millones de personas en situación de desempleo. Una data bastante interesante y que nos lleva a reflexionar sobre esta situación. También hay un punto sumamente importante que lo voy a mencionar acá y ustedes van a poder entenderlo en las siguientes diapositivas, que 4 de cada 10 peruanos están bancarizados. O sea, tenemos 6 por cada 10 que no tienen acceso a la banca. Y algo que es importante, si bien existen las plataformas de geoespaciales para poder determinar mapas de vulnerabilidad, las intervenciones no se hacían bajo un análisis de geolocalización. Este tipo de análisis nos lleva a tomar decisiones inmediatas y acciones priorizando los recursos que todos sabemos que son escasos. La siguiente diapositiva, por favor. Aquí podemos ver también indicadores importantes de empleos e ingresos, ¿no? Ahí ustedes pueden ver que nuevamente el segmento socioeconómico C, D y E está con un porcentaje más alto de personas que perdieron el empleo. Y los ingresos han disminuido considerablemente, ¿no? La siguiente diapositiva, por favor. Es así que el gobierno del Perú, frente a esta situación, para poder reactivar la economía, ¿no? y poder de alguna manera mitigar los riesgos en los que nos puso esta situación del coronavirus, trabajó el bono familiar universal. Más de 5 millones de hogares se han beneficiado con un subsidio de aproximadamente $220. Y es aquí donde se articula el tema de que 4 de cada 10 peruanos está bancarizado. Entonces, al momento de empezar a entregar el bono, muchas personas, la mayor parte en situación de pobreza y pobreza extrema, y la mayor parte adultos mayores de 60 años, se salieron a las calles a hacer colas interminables para poder acceder a este bono. Con ello, se pusieron en una situación de riesgo, ¿no? Son datos que no se tomaron en cuenta. Pero también hay una cosa muy importante. El gobierno lanzó un programa de préstamos a empresas, a MIPES ya establecidas, con tasas de 1 a 2% y entregando periodos de gracia de hasta 1 año. Y otra de las acciones o medidas que tomó el gobierno fue permitir que las personas que habían aportado a un fondo de pensiones pudieran retirar hasta el 25% de lo que habían estado pasando para poder tener una pensión a futuro cuando lleguen a tener más de 65 años. Otro punto importante es que el gobierno subsidió a los gobiernos locales como la Municipalidad de Lima y los 43 distritos que ustedes pudieron ver ahí, y también a nivel de Perú, en todas las regiones con todos sus distritos, para la compra de canastas básicas. Y este punto es sumamente importante, porque también puso en evidencia muchas de las debilidades o puntos de mejora en el caso de poder identificar cuál era esa población que realmente en este momento necesitaba una canasta que pudiera apoyar o mitigar y de alguna manera prevenir el riesgo de enfermarse. Y actualmente se ha lanzado un programa que se llama Trabaja Perú, donde a través de proyectos de mejora como mejora de parques, mejora de vías de acceso, van a permitir que la población del entorno acceda a empleos temporales. La siguiente, por favor. Cuando se había mencionado que se parte de un análisis geoespacial, la Municipalidad de Lima Metropolitana empezó a trabajar con una estrategia llamada Lima Te Cuida. Lima Te Cuida es una estrategia de atención territorial para enfrentar el COVID. Se ha trabajado con 4 distritos: Lima Cercado, La Victoria, San Juan del Lurigancho y Comas. Como pueden ver ustedes en la rueda, en esta rueda hay un paquete de servicios que se adecua para cada uno de los distritos de acuerdo a las necesidades identificadas. La siguiente, por favor. Entonces, ustedes en la siguiente diapositiva pueden observar lo siguiente. La Municipalidad de Lima tiene un paquete de intervenciones que le compete por función y por competencia. Es decir, cada una de ellas tiene un ROF, que es un reglamento de organización y funciones, y de acuerdo a eso trabaja en el ámbito de intervención que es Lima Cercado. Pero luego de hacer este análisis geoespacial, nos ha permitido tener mapas de vulnerabilidad al superponer 4 variables principales, que son el índice de hacinamiento. ¿Qué quiere decir esto? El índice de hacinamiento es que en una habitación conviven más de 5 personas. La población vulnerable mayor de 60 años. Población pobre y de pobreza extrema. Y además de eso, que tengan una alta densidad poblacional. Al momento de superponer las capas, ahí se puede determinar y priorizar en el territorio cuál es el lugar que tiene mayor necesidad y poder entregar servicios adecuados para que puedan contrarrestar y de alguna manera mitigar el riesgo del coronavirus. Es así como ustedes pueden ver que de esta rueda yo tomo, como si fuera una receta, tomo los servicios más adecuados para esa población y le doy un enfoque barrial. La siguiente, por favor. Aquí les voy a mostrar un ejemplo que en el Cercado de Lima hay 268,000 habitantes y nosotros hemos intervenido en 2 espacios, en Santo Cristo y Jardín Rosa de Santa María. Este tiene un radio de influencia de 200 metros. Ustedes pueden ver en el círculo de la diapositiva, es que a través del análisis geoespacial hemos podido identificar un clúster donde a través de esas variables podemos ver que ahí está la mayor concentración de población que está en su situación de vulnerabilidad y que requiere una atención especial, ¿no? Entonces, ahí hemos favorecido a 2.043 hogares. La siguiente, por favor. Acá ustedes van a poder ver que en ese lugar hemos entregado iniciativas, un paquete de servicios que van desde mercados móviles, salud en tu barrio, ayuda humanitaria, Juegos en Casa. Juegos en Casa está dirigido para los niños, para las familias, porque entendemos que la situación de estar en aislamiento en el hogar genera mucho estrés, especialmente en los niños, y se desarrollaron actividades para ellos, para que con los padres pudieran de alguna manera mitigar esta situación. También se trabajó con las familias para poder prevenir no solamente el COVID, sino la anemia, que es una situación que afecta en el Perú en gran cantidad a los niños. Y todo el tema del Lima ambiental, porque la configuración de este espacio son quintas, espacios con un corredor amplio con viviendas a los costados, donde se trabajó capacitando a cada uno de ellos para que pudieran tener sistemas de prevención a través de la limpieza. También en los mercados de estos espacios para poder trabajar la implementación de los protocolos de bioseguridad y cuáles eran las medidas para la desinfección de los espacios, cada cuánto tiempo había que desinfectar, y de esa manera cuidar a las personas que concurren a cada uno de estos espacios que brindan un servicio, ¿no? La siguiente, por favor. De la misma manera, se trabajó en San Juan del Lurigancho, que es uno de los distritos con mayor densidad poblacional. Ustedes pueden ver ahí que tiene más de 1 millón de habitantes, y se trabajó en 2 zonas, con un radio de influencia, como pueden ver en el círculo celeste. También se determinó de todo el espacio territorial de San Juan del Lurigancho, se identificó un clúster donde tenía mayor población vulnerable y donde las condiciones, a través de la superposición de estas variables que mencioné, generaban una condición de riesgo. Aquí se favoreció a 1.067 hogares beneficiarios. Y de la misma forma, una vez que se identificó el espacio, se armó un paquete de servicios para esta población. Ahí ustedes pueden ver manos a la olla, que no mencioné anteriormente, que es a través de los comedores populares, cómo se capacitó a estas personas para que puedan entregar alimentos nutritivos. También había poblaciones que la mayor parte vive en la zona de los cerros, cómo podían trabajar las ollas comunes para poder ayudarse en una situación en que el tema económico no está generando los recursos que normalmente en una situación sin COVID estas personas podían generar. Y salud en tu barrio fue una cosa muy importante, porque una vez que el gobierno decretó la cuarentena obligatoria, no se atendieron muchos de estos temas que han sido una lucha constante del Perú para los temas de vacunas con los niños, como por ejemplo la polio. Entonces, Salud en tu barrio es un servicio móvil que da la Municipalidad de Lima, que llega a los puntos como Huáscar y Tres Cruces en San Juan del Lurigancho, y ofrece estos servicios. Empieza a vacunar no solamente a los niños, sino a las personas adultas, y también ofrece un tema de atención de salud mental, porque es importante decir que frente a esta situación hay mucho estrés, hay muchas cosas que están saliendo y se empieza a hacer un consultorio ahí, ¿no? Y los mercados siempre han sido parte de la estrategia de poder mitigar el riesgo del COVID y de que siga aumentando. Se ha trabajado muchísimo con los mercados de abastos, tanto municipales como privados, con la finalidad de que implementen sus medidas de bioseguridad y que se respeten el distanciamiento social. La siguiente, por favor. Y como ya lo mencioné anteriormente, en estos 4 distritos se han desarrollado campañas de pruebas rápidas para poder atender a esta población vulnerable. Se han hecho muchas campañas, se han hecho 5 campañas de salud en cada uno de estos espacios. Pueden ver ahí, se han desarrollado campañas de salud. Se han realizado los servicios de atención de salud, las pruebas rápidas, y así se ha venido trabajando y atendiendo servicios de acuerdo a un análisis que se ha hecho desde el inicio. Acá ustedes pueden ver que los mercados, acá se ve en la fotografía, tienes los mercados móviles. Esta iniciativa nació porque se veía mucha concentración en los mercados de abastos. Entonces la pregunta era, ¿qué hacemos nosotros para poder descongestionar eso? Entonces se llevaba el mercado mayorista a este punto con la finalidad de descongestionar y nosotros como municipalidad implementar todas las medidas de bioseguridad para que la gente de alguna manera pueda tener productos a precio de mercado mayorista con todas las condiciones de bioseguridad. Ustedes pueden ver ahí en la primera fotografía que hay un cerro, esa es la configuración de muchos de esos espacios con los que hemos venido trabajando. Y de la misma forma se desarrollaron las ferias allí en Payay, que es la fotografía de la derecha, porque entendemos que muchos agricultores, pequeños productores, también se vieron afectados y empezamos a generar espacios para que ellos puedan llevar sus productos a vender y generar recursos para el sustento de su hogar. En la fotografía siguiente, por favor, ahí podemos observar manos a la olla, que son los comedores, que son los lugares donde la población, bajo una asesoría para en temas de nutrición, juntan todos sus insumos para poder atender a la mayor parte de la población con un plato de comida que sea nutritivo y que les permita enfrentar esta situación en la que nos encontramos. Luego, hemos trabajado algo muy importante, el tema de los biohuertos urbanos. ¿Por qué? Porque es una forma de que estas poblaciones en su hogar, con los mínimos recursos, puedan acceder a tener productos frescos, como pueden ver ahí el rabanito, las lechugas, las zanahorias, que les permitan tener productos para alimentar en su hogar a su familia. La siguiente, por favor. Ahí ustedes pueden ver en la siguiente fotografía las quintas limpias. Esa es una quinta, como lo mencionaba anteriormente. Allí se ha trabajado campañas de limpieza. Nosotros hemos ido con un equipo a enseñar a las personas cómo limpiar, cómo desinfectar, para que de alguna manera esto se mitiguen los riesgos. La siguiente, por favor. Ahí podemos observar salud en tu barrio, que es lo que les mencionaba, que llevábamos estas campañas de salud, tanto mental como de vacunación para toda la población, ¿no? Muy ordenado, guardando todas las distancias sociales, cumpliendo todos los protocolos, ¿no? Y se empezó a vacunar a los niños porque los padres tenían temor de ir a los hospitales que, como todos sabemos, en el Perú estaban colapsados. La siguiente diapositiva nos va a permitir mostrarles a ustedes rápidamente, porque sé que estamos con los tiempos, las medidas que la Municipalidad de Lima ha venido realizando para la reactivación de la economía. Uno de los trabajos que se ha realizado es los espacios temporales. Como mencioné anteriormente, actualmente tenemos cerca de 2 millones de ciudadanos que están sin trabajo, desempleados. Muchos de ellos salieron a las calles a trabajar de manera ambulatoria, son los comerciantes informales en la vía pública. Para dar un ejemplo, teníamos a cerca de 50 personas en una cuadra vendiendo productos al paso. Esto generaba focos de contagio y cada una de esas personas eran vectores de contagio que llevaban la enfermedad por donde iba. La Municipalidad de Lima levantó mucha información, se hicieron encuestas, porque como ustedes comprenderán, habían personas que estaban muy reacias a este cambio, pero hubieron otras que sí querían salir de ese espacio y tener otra oportunidad. Es así que la municipalidad, teniendo unos parques zonales que en ese momento estaban en inactividad, porque no les correspondía en esa fase activar, se utilizó el 1% de estos espacios para generar un espacio adecuado para que estas personas pudieran vender cumpliendo todos los protocolos de bioseguridad, desde la toma de temperatura, la desinfección de las manos, el control del aforo, la seguridad. En este trabajo realizamos un esfuerzo articulado con el Ministerio de la Producción, que ve todo el tema de microempresas, con el Ministerio de Defensa y el Ministerio de Salud, porque como el resultado fue que 2.000 comerciantes fueron reubicados en 3 parques zonales, ¿no? A los cuales se les hicieron las pruebas para que cuando vayan a vender haya la seguridad de que estas personas no sean focos de contagio. Entonces luego viene, ¿qué hacemos con estas personas? Son informales, hay que empezar a hacer todo un trabajo de formalización. Es así que a través de los conglomerados comerciales que en Perú tenemos, varios, pero con los que trabaja la municipalidad son 3, el conglomerado del Mercado Central y Mesa Redonda, GRAU, y las Malvinas, se identificó espacios para que estas personas pudieran alquilar. En la fotografía ustedes pueden ver que es una galería que ha ofrecido espacios, entendiendo la situación en la que estaban, pagando solamente 200 soles mensuales durante un año. Entonces estas personas han accedido. Ahorita estamos en un proceso de sensibilización. Al momento ya se han logrado, de los 2.500, 300 comerciantes firmar un contrato y tener un espacio de venta con todas las medidas de bioseguridad. Entonces, entendemos que la informalidad en el Perú data de muchos años atrás, pero también esta crisis nos puso en evidencia esas debilidades, y frente a esto lo hemos tomado nosotros como una oportunidad de buscar alternativas para que las personas que desean asumir el reto, bajo el acompañamiento de la municipalidad, puedan formalizarse tributariamente y en un espacio físico que cuente con todas las medidas. Otro trabajo importante que hemos venido realizando es el sector artesanal está sufriendo hoy en día mucho con la situación. Ellos normalmente tenían tiendas donde vendían sus productos, iban a muchas ferias y se trabajaba la venta y la generación de espacios para la venta de sus productos. Pero entendiendo que estamos frente a una situación de crisis y siendo que los productos que ellos venden no indispensables y prioritarios, la situación de ellos actualmente es crítica. Por eso la Municipalidad de Liñamena empezó un trabajo con diseñadores, el grupo de artesanas, todas mujeres, artesanas amazónicas y andinas, que hacían sus trabajos en el pintado en las tablas de sarwa, que es una técnica de la región Ayacucho, y las amazónicas que hacen bordados. Y se empezó a trabajar este tipo de mascarillas que ha permitido a estas personas tener una forma de venta y de generar recursos. Y más aún, luego lanzamos la campaña, yo hice mi propia mascarilla, donde se trabajó con ellas que pudieran vender un paquete que incluía los insumos para poder elaborar tu mascarilla y aprender el bordado y el pintado dependiendo del interés del cliente, y a través de un tutorial empezar ese trabajo, ¿no? Entonces, este es un trabajo que nos está dando muy buenos resultados y vamos a seguir en esa línea. El siguiente punto, que son los mercados móviles, como les mencioné cuando se declaró la situación de emergencia, los mercados minoristas tenían dificultades para poder trasladarse porque había toque de queda y había impedimento de traslado. Es ahí donde las personas que realizaban el flete elevaron a un 200% el flete, con lo cual el producto que se compraba en el mercado mayorista llegaba a un mercado minorista con un 50 y hasta ese 100% más. ¿A quiénes afectaba? Afectaba a la población que menos tenía, llegando a un producto caro y no asequible a los bolsillos de los ciudadanos. Entonces, nosotros como municipalidad, al tener como el gran mercado mayorista, empezamos a desarrollar estos mercados móviles y íbamos a las zonas de mayor vulnerabilidad, llevando productos con precio mayorista. Esto nos ha permitido realizar 55 mercados a la fecha, hemos beneficiado más de 30.000 personas y se han movilizado más de 480 toneladas de alimento. En el siguiente punto vemos la lima gastronómica. En el Perú, la gastronomía es sumamente importante. Tenemos las banderas, las personas que venden en las ferias, los emolienteros, las que venden los postres típicos. Entonces, hemos empezado un trabajo hace un tiempo atrás con ellos, primero para que sus módulos se adapten e implementen las medidas de bioseguridad, y luego la capacitación en cómo atender a un cliente con productos solo para llevar y cumpliendo todos los protocolos de bioseguridad. Y es así que de verdad nos sentimos muy felices de presentar en una primera feria a 20 mujeres que han logrado 37.000 soles en ventas y favoreciendo 6.300 comensales, ¿no? Ahí ustedes pueden ver en la foto. La siguiente, por favor. Y también la municipalidad sigue trabajando, como les había mencionado, tenemos 3 conglomerados comerciales, que son las Malvinas, Mesa Redonda, Mercado Central y Grau. Entonces la municipalidad, junto con un trabajo intergerencial, defensa civil, fiscalización, seguridad ciudadana, servicios a la ciudad, la gerencia de desarrollo económico, se trabajó en equipo, con una cuadrilla de profesionales que asistían a cada uno de los 66,000 stands para poder ayudarlos a elaborar su plan de bioseguridad y luego la implementación. Es un trabajo de hormiga que hemos venido haciendo hace 2 meses atrás. A la fecha vamos con cerca del 90% de los 66,000 que ya han abierto y están atendiendo y están cumpliendo con su plan de bioseguridad. Luego viene un tema. En los mercados, cuando se inicia la pandemia, solamente se podía vender todos los productos que eran de primera necesidad. Sin embargo, en los mercados, como todos sabemos, existen personas que dedicadas a la gastronomía, que venden sus productos, que venden sus platos. Entonces, estas personas durante casi 3 meses no pudieron atender. Pero en ese tiempo hemos venido trabajando con cada uno de estas personas para que ellos puedan implementar sus protocolos de bioseguridad, como pueden ver en la foto, también con los restaurantes del Centro Histórico de Lima y con las asociaciones de vivanderas, con la finalidad de que puedan seguir trabajando, generando ingresos para sus familias, pero cumpliendo todas las medidas de bioseguridad. La siguiente nos permite ver los mercados modelo. Como ustedes saben, el mercado Ramón Castilla es uno de los mercados más emblemáticos del Perú, y este mercado ha sido nominado como un mercado modelo porque se han implementado las medidas de bioseguridad, y como pueden ver, se ha trabajado en 25 mercados públicos y privados. En Lima Metropolitana tenemos cerca de 1.200 mercados. En el cercado de Lima, que es el ámbito de intervención de la Municipalidad de Lima, hay 47 mercados, de los cuales en 25, que fueron priorizados por el Ministerio de Salud, se han trabajado cada una de las medidas de bioseguridad, desde el lavado de manos, desinfección, de los zapatos, la toma de temperatura, el control de los aforos, en cada uno de estos 25 mercados públicos y privados. Pero también continuamos con el tema de los negocios. Nosotros como Gerencia de Desarrollo Económico trabajamos con los negocios y teníamos una incubadora de negocios llamada Lima Crea Contigo, pero nos innovamos y la lanzamos online. Se tuvo 170 postulantes, se preseleccionaron 50 y estamos en un proceso de incubación de 17 negocios. Cada uno de estos negocios tiene una fuerza laboral detrás. Eso es importante para que no haya tantos desempleados, para que las personas sigan emprendiendo, sigan haciendo negocio y de esa manera colaborando con el desarrollo del país. También hicimos alianzas con el PNUD, en este caso se trabajaron con los laboratorios de fabricación digital con la finalidad de crear estas pantallas o cascos protectores en los mercados. Esto se trabajó en el mercado Ramón Castilla. ¿Por qué? Porque esta propuesta fue ideada.
Patricia, could we please try to wind up the presentation? It is very interesting, but we have one more session following. Could you please try to conclude?
Sí.
Thank you very much.
Sí, ok. Y voy a pasar rápidamente a la siguiente, ya no voy a profundizar más. Se ha trabajado el portal web de apoyo a los negocios locales, la plataforma educativa virtual para emprendedores. También al entregar autorizaciones comerciales se ha generado que se haga en línea, o sea, nos hemos adaptado a la situación, y se lanzó a Anita, que era una asesora municipal, con la finalidad de atender temas de licencia, de seguridad sanitaria, inspecciones técnicas y gestión empresarial. Acá los dejo con esta fotografía de las mascarillas que se trabajaron con las mujeres de la Amazonía, y con la foto que se ve a la derecha, que es una artesana de Ayacucho, una de las regiones del Perú, que pintaba en estas tablas que pueden ver ahí, tabla de Sarwa, ¿no? Y con eso concluyo mi presentación. Les agradezco y me disculpo por haberme extendido con la presentación. Muchas gracias.
Oh, thank you, Patricia. It was very, very interesting how Lima cares for its people, and also the illustration of very concrete and very tangible projects. And I think yet again, a very fantastic presentation that inspires many of our participants. We still have 119 online. This is really great. Anna, I would like to ask you to just do our last interactive session while we are preparing for a concluding panel dialogue on regional perspectives. Thank you very much.
So hello again. We'll do this very quickly. After listening to the speakers, city speakers, we would like to ask you who you think have been the most effective actors in your city in addressing the impacts of the crisis. So let's just take 30 seconds for this. So far we have local government communities having the highest percentage. Also NGOs and CSOs. And then national government, private sector as well. Again, it's nice to see that there's a lot of actors that have been effective in your cities. Okay, so let's go to the next. In which area do you think your city should focus their economic recovery measures on? So if earlier we're asking for priority actions, here on which areas should these priority actions focus on? Let's again have 30 seconds for this. Okay, so there's the word employment, formalization, sustainability, climate, small businesses, pro-poor access, urban planning, let's see, climate again, informal markets. Great, thank you so much for participating. And lastly, so do you feel like your city's current actions are gearing towards resilient economic recovery? After listening to our speakers, after listening to our panel, or the different cities that have shared, what do you think is the state of your city in terms of resilient economic recovery? Okay, so it seems like we are a bit on the strongly disagree side, well, on the disagree side, and hopefully as cities become more used to the crisis, the impacts of the crisis, and as Esteban said earlier, we're all blind, working blind here, but as these kinds of dialogues continue, we will get to learn more and address these problems in a more resilient manner. Thank you, and I will bring this back to Katya.
Thank you very much, Anna. We are actually approaching the closure time, but I hope participants will still manage to hold on because of the interesting discussions. We might go 20-25 minutes over time, and I would like to straight move into the next session and in fact invite our regional representatives to reflect on the findings of the different case studies, to look at the common COVID-19 impacts and responses in their respective regions, as well as look at promising areas of interventions maybe to address anticipated challenges. And I would also like to ask our regional representatives maybe to build a bridge towards towards gearing the implementation of the Agenda 2030, where the New Urban Agenda as well as all the SDGs play a very, very important role in light of the resilience discussion and this, of course, the economic angle of the story. So Suhaina Al-Nasrawi has kindly put up her presentation, and I would like to invite you to reflect on the questions from the perspective of Western Asian and Arab region. Over to you, Suhaina. if you are still there, Suhaina.
So somebody unmuted me and then muted me. I don't know.
Okay, then welcome back.
Okay, so I was saying, just for those who joined after the introduction, my name is Sukaina Al-Nasrawi, and I'm a Social Affairs Officer working at UNESCO, currently leading the portfolio of Sustainable Urban Development. It's a pleasure to be among the present experts, and listening to the different cities was very, very enriching. One common observation, honestly, is that COVID-19 is the same pandemic that hit all cities, all countries across the world. And I can see from the cities presented a common impact, common measures taken. But as Reem said, and as Dimitri started at the beginning, it's based on the intensity of the shocks is what mattered, and that the intensity was based on the context of the city. Having said this general observation, I'll delve more into providing you with perspectives on the socioeconomic impact of COVID-19 in the Arab region, and some of them linked to the presentation of Alexandria, which is a very good example of the region. Now, in terms of prevalence of COVID-19 in the Arab region, we can easily say that most of the Arab countries were very heavily affected by the virus. In the beginning, transmission was kept to, and mortality rates were kept to a minimal, but like afterwards, recent trends became cause for concern, and they started bringing to light, unfortunately, reverses in human development gains, especially that the region has lots of countries in conflict. Of course, we have to mention in here that urban areas have become the epicenter of the pandemic. So, and here lies the importance of what we're talking about. In terms of selected COVID-19 main control and mitigation measures, these were common across the globe, and particular also to the Arab region. There were quarantine measures taken across the Arab region. There were social distancing measures forced in the Arab region, in the different countries and the cities, of course. There were restricted use of public and private transportation, travel restrictions, lockdowns, and unfortunately lockdowns led to limited economic activities, which affected, of course, the economy, and border closures, which affected trade of social goods, for example. And in terms of mitigation measures, most of the governments in the countries, of course, with varying capacities, and this takes us back to the capacities concept that Dimitri was talking about, developed welfare programs and stimulus packages, and we'll talk more about that at a later stage. So, were Arab countries prepared? This is the questions that we ask. Were cities really prepared? Were municipalities prepared to address this pandemic? Grosso modo, we say no, they were not prepared, or at least there was a huge variance in the level of preparedness. We can see from this list, I'm not going to go really into the details because of the time. The information is there. If you have any question, I'm available. But an adaptation from the Human Development Index to the Arab region shows that there was a variance in the level of preparedness of Arab countries when it comes to the health system, when it comes to expenditures, when it comes to connectivity, and we know that technology was really needed throughout this time at different levels to spread information, e-schooling, and so on and so forth. One observation to note to you is that the Gulf countries were more at the medium level of preparedness. Unfortunately, many countries that are under conflict, which is unfortunately a trait in the region, were not prepared, and if prepared, were very minimally prepared. In terms of the impact, the socioeconomic impact of COVID-19 in the Arab region, let me start by saying that the pandemic already magnified many decades-long challenges, let's say. And the impact were devastating because we had prevalent poverty and informality, conflicts in the region, displacement, shrinking oil revenues, etc. So without talking generalities, in terms of the GDP, the Arab region suffered from a loss that summed up to $152 billion. That is up to the end of the second quarter only of 2020. And this of course, is a result of a contraction in the economic growth that reached around, that the estimations state it reached 5.7%. Now, in one of in the opening speech, Ms. Ruzvidzo also mentioned that the global GDP decline was about 4.2%. In the case of the Arab region, is even higher than that, which is very alarming. And on this point, I want to highlight a twin shock that the Arab region is facing in terms of the economy. And I want to note this because our main concern in this project and in this webinar is the economic resilience. In parallel to the loss in real GDP, which is a result of the pandemic, there were acute decrease in the prices of the oil, which led to a loss in the Arab stock by about 23%. So it's a twin shock to the economy in the Arab region. In addition to that, the pandemic, the estimation shows that the pandemic led to a loss in jobs measured in working hours, of course, to 17 million jobs. And this adds to more than 14 million unemployed youth in the region. So imagine the unemployment rate in the region as a result of the pandemic and building on what existed already. In terms of poverty, unfortunately, the estimation shows that more than 14 million people are gonna fall under the poverty line. And already the region was suffering from a high prevalent poverty rate. And by these additional people pushed into poverty, the estimation is that 1/4 of the Arab population is gonna be poor. So without really taking the good measures, the impact of this is going to be major. Of course, all of this increases the vulnerability of older people. It increases the vulnerability of people already, of migrants, of people in need of humanitarian aid. And as I said, there are different countries in the region that are under conflict. And in that context, there are many internally displaced people, and these are vulnerable groups that we have to take into consideration. In terms of access to hand washing facilities, because of the lack of access, of equal access, and here we go back to the 2030 agenda main drive, which is leaving no one behind. We cannot leave people without hand washing facilities. This is one of the issues. Leaving them without hand washing facilities, the estimation shows that more than 74 million people are gonna get the virus. So if we delve more into the impact from a gender equality perspective, first let me note that unfortunately, the Arab region also suffers from the largest gender gap in terms of human development in the world. And therefore, women are suffering the more impact in terms of the consequences of the pandemic. In terms of labor market, as I said, 17 million jobs are going to be lost. Out of these 17 million jobs, there are 700,000 jobs already are currently held by women. They're going to be lost. And the women labor force participation is already very low. So imagine losing additional 700,000 job opportunities. Zooming into there are so many details that I'm not mentioning, but time does not really permit it. I'll zoom more into the economic impact of COVID-19 in the Arab region. And if we look into the region's fiscal revenues, the estimation is that the region is expected to experience a loss that sums to $20 billion in indirect taxes. And to respond to this drop, fiscal deficits are going to increase by an average of 10% of GDP in 2020, whereas it was around 3% in it in 2018, which is a very, very, very big increase. It's like 5 times more, or like 4 times more. So these deficits, when they increase, they're likely to be financed by increased borrowing. That is likely to be an additional burden even to the Arab countries, and which will lead to more debt. Fiscal, I mentioned in the beginning that governments are designing welfare programs and stimulus packages. In the case of the Arab region, the regional fiscal stimulus in the Arab region amounted so far to around $100 or $102 billion, which constitutes 4% of the GDP compared to 11%, the global average. And of course, there is a serious drop in revenues from tourism, remittances, trade, and general economic activities, as is the case in many other countries and cities around the world. If we move more into the economic impact, but at the local level this time, so basically regional, and then we're moving to the local level. And if we specifically look into the municipal revenues and municipal expenditures, a review of the Arab region shows that the local government capacity in terms of financial management is insufficient. And the local inflows do not really cover expenditures, and local investment budgets are very minor. So municipal revenues is a big question mark. The municipal expenditures also adds to the challenge, because coupled with the low level of local revenues generation, the high operating expenses of the municipality have shrunk Arab cities' fiscal space over time, therefore leaving no choice but to depend on central government transfer to pursue infrastructure investments. These two observations basically note that basically affected the ability of local governments in responding to the pandemic in the Arab region. This is in terms of the impact, the quickest possible at the region, in the Arab region. Now moving to the response in the Arab region. ASCWA at the regional level went through an exercise where it mapped the COVID-19 policy responses in the Arab region and focused on social protection policies, economic policy support, and a combination of both. Of course, the target beneficiaries varied between individuals and families, poor households, small and medium enterprises, etc. So different target beneficiary people, different target beneficiary businesses. It is available online. I'll be sharing the link at the end of the presentation, but one main observation to share with the panelists and the attendees is that the Arab region showed common top 5 social protection policy measures in the top 5 social protection policy measures. These were cash transfers and income support, which matched with the common measures at the global level, income transfers and or food vouchers, and that was also a common measure taken at the global level, but ranked 3rd. Loans and interest deferment, waiver of utility bills, and stocks of basic goods and medicine. So these are main key measures taken in the Arab region to mitigate the impact of COVID-19. I'll be ending with few key observations from the Arab region and key entry points to share based on our review for the region and based on the cities that we've worked on. I mean, all countries in the Arab region and all income groups of populations were negatively affected by this pandemic. So everyone was affected, but of course, the way that the intensity of the impact varied, it varied based on the context itself, it varied based on the infrastructure of the country and the city, and based on the development. The impact on people, businesses, workers, and families varied also by sector, by enterprise conditions, and by workers' status. Countries with an important observation is that countries with developed social protection systems were in a better position relatively to respond during the crisis. So this sheds light on the importance of social protection systems. The lack of adequate fiscal space was a challenge for extending social protection, especially in the middle income countries and the LDCs. There was a need for robust monitoring and reporting to understand gender differences in socioeconomic impacts. Like, for example, when we, and of course, this is important to inform the national and the local strategic plans on COVID-19 preparedness. Like, one example is the one I mentioned in terms of employment. The employment was severely affected, and a high toll of probability estimation was related to the informal sector, which was affected by about 87 to 90%. And we all know that women in the Arab region occupy more than 65% of the informal sector. So being informed of those facts help in informing national and local strategic plans. Of course, we need to protect women from falling into poverty and, as I mentioned, the informal sector. I'll end with the emerging set of priorities for the Arab region to respond to COVID-19. In a nutshell, there is a need to slow the spread of the disease, end conflict, and attend to the most vulnerable. And when we talk about and conflict here has a very is high on the agenda, because, as you know, it destroys all the systems in terms of health, in terms of health systems and the infrastructure and everything. We need to build back better by taking into consideration the vulnerable groups. In the Arab region, we have a huge number of internally displaced persons. We have, as I said, refugees also. And watch out for the greater inequality that will happen, because already the region is suffering from the highest gender gap, and what the impact is gonna most probably increase that. Boost economic recovery and pay special attention to the small and medium-sized enterprises. And this takes me back to what Dimitri was saying, the entrepreneurial state. This is very important, especially at the national and city level. And of course, seize the opportunity to reform the institutions, the public institutions, the local authorities, and keep in mind that every crisis brings opportunities, and we have to find new ways of doing things as opposed to relying on old habits. Thank you so much. I'm sharing the selected key references used and additional resources that you can find. And I thank you so much for your attention and ready to take any question you may have. Over to you, Katya.
Oh, thank you, Suhaina. I would like to invite actually Dana now to reflect on the African feedback or the African regional perspective. Dana has no presentation, but I think she will give us a good review on the impacts and responses in the region, the findings on the case studies, and also how to address maybe some of the anticipated changes. So Dana works with the Global Resilient Cities Network focusing on Africa. She's the managing director there. Over to you, Dana, and thank you for your patience.
Thank you so much, Katya, and thank you everyone for the wonderful presentations. I'm recognizing that we're nearing the end of this workshop, and I'm sure we're all quite tired, but I'll keep my remarks brief and just share just a few reflections from the region. First, let me start by just briefly explaining what the Global Resilient Cities Network is. We are a network of 97 cities worldwide. And 10 of our cities are in Africa, and I manage a portfolio of cities in Africa, but I also work globally across our network. We're the world's leading urban resilience network that is city-led and impact-focused. And we are continuing the work of a previous program called 100 Resilient Cities. So although the Global Resilient Cities Network has been around only since last October, we continue the foundational work of 100 Resilient Cities that has been working in the urban resilience space since 2014. Obviously, as Sukaina rightly mentioned, you know, this is COVID has been a very unique shock because it has impacted all of our cities simultaneously, at the same time, cities around the world are experiencing many of the same impacts and shocks at the same time. So it's really a unique moment in time, especially for a city network such as ours. I wanted to share just 3 main reflections from the last several months of working with cities on thinking about how they both respond and recover from the COVID-19 crisis. So first of all, I think the first reflection that we've seen from the region is that, and something that even and all of the regional reflections I'm sharing are also, I think, can be thought of as global reflections as well. One of the things that we've seen is that while cities are needing to manage this crisis, they also have to manage this crisis while simultaneously building the future. And they need to be asking themselves that question of what kind of future do we want to see in our cities? And in thinking about the future, and this is a point I want to stress, they don't just have to think about shocks and future shock events, but they also need to think about those long-term, slow-burning stresses. And when we've done several rounds of surveys in our network since the crisis has hit, and you know, while cities were grappling with how to deal with just the immediate impacts of the coronavirus, they also were thinking, you know, about how they manage long-term stresses such as unemployment, informality, and food insecurity. Now, especially in the Africa region, we saw a lot of emphasis and a lot of concern amongst our cities around food insecurity. And we started to see some really interesting interventions across the network. For example, in Lagos, our team, the Resilience Office of Lagos, worked with the private sector and partnered with the private sector to support the state government's ability to deliver food to vulnerable residents across the state of Lagos. And they realized that the state realized pretty early on in the process that they wouldn't be able to manage sort of access and reach all the people that needed the food packages themselves. And so that partnership with the private sector proved to be a very valuable tool for the state. In the city of Addis Ababa, also a member city of our network, one of the things that was interesting is, you know, Addis has been talking for a long time. And if you look at their resilience strategy, which we released in June, one of the big, big ambitions of the city is to really incorporate more urban agriculture in the city and to really build a more sustainable and resilient food system. And when the COVID-19 crisis hit, it forced them to really think about their food security issues and to think about creative ways to address their food insecurity issues. So they immediately started looking at where empty spaces in the city and thinking about where they could deploy youth volunteers and people with an agricultural background to do things like building urban gardens and planting sort of more green spaces in the city. The second big sort of reflection is that, you know, there is going to be a huge influx of recovery funding and stimulus funding to these cities. And the question now is, how can you maximize every recovery dollar to meet multiple benefits? Core to the practice of urban resilience is getting multiple benefits and really achieving that resilience dividend for every dollar you're spending. And COVID has really highlighted the need to do that even more. So cities are thinking about how they can really maximize this moment and the funds that they will be getting. So for example, as they're thinking about, you know, changes and adjustments that they have to make as a result of COVID to their transportation systems, they need to be also thinking about how they can meet their climate adaptation goals. For example, you know, Moses was talking earlier about markets and market upgrades. I've been working with the city of Accra and the AMA for several years, and one of this issue of markets has been something we've been talking about with the city for many years. And you know, initially when we were working with the city on the resilience strategy, we were thinking about how do you safeguard markets from fire and flooding, which are two major shock events that generally impact the markets. Now we're thinking about, okay, how do we make these markets smart? How do we make them more COVID resilient and more that enable the mostly informal workers who work in those markets to be safely socially distant while also you know, making, you know, selling their goods and making their livelihoods. And so, you know, thinking about all of the investments you're making across the city and thinking about how you can maximize every dollar to yield multiple benefits is certainly something that we're working very, you know, closely with our cities to to ensure happens as these recovery funds start to flow in. And the third reflection I'd like to make, and I think it's something that we need to do some more, I think that requires a lot more discussion. And again, I think Sukaina brought this up, is that, you know, municipalities that really need to think about how they can be financially sustainable moving forward. One of the biggest things that we're seeing is cities are facing huge budgetary shortfalls. And so in a sense, cities really need to think about what is the minimum viable product that they must offer their citizens? What are the basic services that they need to focus on? And where can they make cuts without impacting those basic services? This is something that we're still grappling with across the board. And I think this is not just an African city problem. It's a problem that we're seeing in cities as far-flung as San Francisco and New York City. So thinking about how cities and municipal budgets can be more financially sustainable, what cuts make sense now? And, you know, one of the key things that's really critical in making those decisions is good data. And one of our cities, Cape Town, for example, one of the innovations that they managed to develop throughout this, as a result of this pandemic, is they were able to really overlay a lot of different data points and create a sort of a vulnerability dashboard. So now they're able to see not only they're able to track all of their urban systems against where the COVID crisis was most acute. And they're using that dashboard now to make budgetary decisions moving forward. And I think that's a great innovation that we've seen. It's a really great example of sort of maximizing the opportunity presented by a crisis. And so, you know, just in summary, I think, you know, these are big themes that cities across the region are thinking about, and I think that merits further discussion, and I look forward to discussing that with all of the participants here. You know, in closing, I just would like to say that, you know, one of the things that we as a practitioner network of cities have done is we've developed a platform called Cities for Resilient Recovery, which we launched in May. And the intent of this platform is as an online platform to give tools and be a space for knowledge exchange and peer-to-peer exchange among cities. And economic recovery is certainly one of the areas that we're thinking about. So I'm going to put the link to that platform in the chat. Please feel free to visit, to sign up, and to join this global conversation that we've started, and to keep connecting with other cities and learning from other cities. So again, thank you very much for the opportunity to speak here today. I'm very happy to answer any questions you may have. Thanks. Over to you, Katja.
Yes, thank you, Dana. And I'm sure there will be many comments in the Q&A box. I mean, keep looking out for them, try to answer them. I think it's a great networking opportunity here. And I think we saw some really inspiring examples also when it comes to the points that you raised, which include, you know, the local financial sustainability and how we can use, in fact, this crisis and the response to strengthen and maximize, as you said, the opportunities. And I can see here now on the screen, we have Diego Aulestia as the next reflector from the Latin American Caribbean region. He is the Chief Human Settlements Units Officer, and I would like to ask you, Diego, to reflect from the Latin American and Caribbean perspective. Thank you.
Thanks, Katia, and good afternoon to everyone. I'm going to share the screen for my presentation. Yeah, I just want to go very, very quickly since the time is really running out. I think that you can see it.
It is there, yes.
Yeah, it's there. Okay. So, well, first of all, of course, clearly the economic context of the pandemic. I'm going to be really quickly in this because I want to focus on the strategies and proposals that we have at ECLAC. Clearly, the decrease in the GDP per capita, you can see there. That's why at ECLAC we have been talking about another, again, lost decade. In 2020, the GDP per capita is going to be at the same level than 10 years before. So that implies that we are losing all the social gains, all the advances that we might have had in the last few years. In terms of decrease in the GDP, clearly there is a massive a massive decrease in economic activity in the countries of the region. You can see the situation for the whole Latin American and Caribbean region is minus 9.4% in evolution of the GDP, and there are even 3 countries that they will have 2 digits in terms of the economic activity, of the drop of economic activity. Something that is really concerning to all of us, I think that all of us that are involved in development, is increase in poverty. We are talking here about 44 million people that will join the population below the poverty line. You can see that there will be 7% increase in poverty rate, and of course that implies as well, or that incorporates an increase in extreme poverty. In some of the countries of the region, the situation is going to be extremely bad, and that's why we are proposing some ideas. Impact in the region, we have gone through this. I'm not going to add anything particularly new. I will just highlight the challenge for the local governments, that they have been under pressure from their citizens to additional expenses, to incur in additional expenses, and at the same time, they have a decrease in their incomes, both from the transfers from the central government, from the national state, and also from the collections at the local level. Our aim as at ECLAC in general, the UN system, of course, is to provide some guidelines, some suggestions to the local governments, to the national governments, in order to move forward. Some of the measures, some of the actions that have been adopted in the region in terms of rental housing, in terms of long-term housing finance, there have been some deferral of payments. There is other line of actions as well that have been implemented. 2/3 of the countries in the region have implemented subsidies for vulnerable households or investment incentives in terms of renovation and construction, building of dwellings. In terms of public space, it's natural, of course, and as well in terms of public services, in terms of utilities. I will like to mention as well the frustration that it's present, since this is a crisis that we were not really prepared for. It comes in the context of a difficult situation for the region. It comes in the context of natural tensions between local governments and national governments. But also, it's clear that in terms of resilience, most of the strategies, most of the thought that was out there was related to climate change, which also is the greatest crisis of all, and we have to be concerned about that. But we were not really prepared to have a sudden drop in economic activity, increase in employment in such a massive way. That's why there has been the pressure to economic reopening, and that creates a lot of problems in terms, or a lot of tensions, I will say, in terms of local governments and so on. Pandemic also puts a lot of pressure on local governments to spend more, to increase its expenditures, and to grant tax benefits, while at the same time, there are restrictions on economic activity, which imply lower incomes for the households, lower incomes for the local governments, lower incomes for the national governments. So that's why at ECLAC, on a general framework, we have proposed quite a few strategies. A basic emergency income, which is equivalent to a poverty line for 6 months. Hunger subsidy. You know, there are people with increasing levels of poverty. We need to take care of that. Of course, to arrange as well, or to modify the terms and the periods of repayment of credits, particularly for the small and medium-sized enterprises. To have expansionary fiscal and monetary policies, that those are key to provide additional resources in them, and finally to increase levels of investment, and clearly to have universal, progressive, and redistributive social protection. And that comes only only insofar we have political and fiscal pacts. To expand a little bit on the importance of green recovery, we have been talking about sanitary measures, we have been talking about short-term responses, but I think it's extremely important, and we at ECLAC, we do think that it's extremely important to emphasize that we cannot go back to the normal. I mean, the previous situation was not normal, and we have to be very keen on that. We need a more sustainable, green, and inclusive reconstruction, and that's why we are arguing about the importance of the big push for sustainability, which is a set of actions, investment, of course, public and private investments, regulations, all moving forward in terms of getting or achieving a green recovery. And one line of example that I want to present, and this is my final slide, one example that I want to present of an investment program that creates employment, that it involves a low environmental footprint, and as well contribute to the democratization of the productive fabric, is the investment in housing improvement. I have been taking here the case study or the example of Lima, the capital of Peru. Patricia Talavera presented some of the actions that the municipality is already applying. Clearly, in terms of being concerned about employment, when you presented, all of us have seen the results of the Mentimeter. Clearly, employment is at the center of our concerns, and here we are presenting an example of an intervention that could, at the same time, increase employment and also to be working with social needs in terms of housing. In Lima, 400,000 houses use precarious materials, and this is information from that we have processed internally of the census, of the national census, and also of the household surveys. There is an important problem of overcrowding, and also the idea here is that the overcrowding is presented not only in the informal settlements, which is the case as you can see here, but also, for example, in rented homes. Yeah. The line of thought that we are introducing here is that with an investment that could go from $600 million to $2,000 million, depending on exactly what we want to achieve, it would be possible with this investment to improve the quality of the housing, to decrease overcrowding. Right now, we are talking about the sanitary measures that we have to take. Clearly, one of the most important factors, or one of the most important elements in the pandemic, has been the overcrowding in terms of the possibilities of contagion. We have to argue again and again that the spread of COVID-19 is not necessarily related to density. It's related to overcrowding, which is very, very different, and we have to be clear about the distance between the two elements. So with an investment of $600 million or $2,000 million, we can considerably, we can improve the quality of the houses. We can basically eliminate overcrowding. We could generate about 300,000 jobs. And that's also the situation with the units that are actually used as workplace. There are 500,000 houses in Lima where people are developing productive activities. So that also adds to the problem of overcrowding. That also adds to the problem of productivity in the cities, and that's also the expression of livelihoods, of urban livelihoods, and it's very important to work on those issues. Just as a reference, last year in Lima, 110,000 households received credits, formal credits, that were aimed to expand, to upgrade, to build new housing units. And out of those, 60% were used in precarious settlements. So what I'm trying to say is that this reinforces the importance of housing improvements, that there is an important opportunity there that could be seen also as an opportunity for private business. But clearly, there should be a public policy action in terms of increasing the quality of the housing, and at the same time providing jobs. And that's a very small example, or of something that could be considered as an example of big push for sustainability. Thank you. That's all.
Thank you, Diego, and thank you actually for bringing the housing discussion at the center of, or towards the end of this session, again reminding us, how important it is to have a good quality of life, also in terms of the resilience discussion, and looking at improving housing conditions, improving living conditions, also to generate jobs, generate livelihoods, having a green angle to it, and also a finance dimension to it, how we make housing better accessible to people, or improving their situations. I would like to, in fact, Diego, if you don't mind, and the other panelists, if you don't mind, I would like to move to the concluding session. And in fact, Diego, one of your colleagues, Jose Luis Samaniego, will from the Economic Commission for Latin America and the Caribbean, summarize the event today. Over to you, Jose, please.
Thank you very much, and thank you for allowing me to participate in the workshop on economic recovery and urban financing for resilience in COVID times. Of course, it's impossible to summarize the richness of your workshop. It's been ranging from case studies to a general raconto of how entire regions have responded to the COVID emergency. What I think is very valuable to underline is the opportunity we have as participating institutions and partners in this endeavor under this development account to be able to share, to learn, and to improve the chances of a better response. Diego, my colleague in the division, has already underlined the possibility not only of improving living conditions, improving consumption patterns, but under the concept of a big push for sustainability, we can reap the benefits both of changing consumption patterns with simultaneously changing production patterns. And that is intended to maximize the positive externalities of changing the direction of development. I liked what Ms. Omram said about the risk of insecurity, of course, of maximizing co-benefits. That should be the approach. And I think that we should welcome and take advantage of the change of priorities that this crisis has brought to us and to policymakers. We have seen a very dangerous, let's say, underinvestment in public services, in public goods, and we are seeing the consequences of that lack of precaution, of that speech, of that narrative that says that public services and public investment have not been that important. It is important, it is very important at the local level, and we mustn't risk underinvesting in public services, in public goods. Not everything is income earned in the labor market. A good deal of the welcome of the welfare for people relies on the good quality of public services, and that we have to keep in mind. Key challenges to face, of course, funding is a universal challenge, and local governments will have to update their fiscal practices and diversify their options. I think this is a very good opportunity to enhance regional cooperation and international cooperation. And we have, Diego mentioned one, which is housing, of course, regularization, improving building conditions. But we could say the same about, for example, public transportation is a very good opportunity too to improve the quality of life of people, and more, all the more now when we have to be under social distancing in the public space. We need much better mobility systems. And what better option that have a program coordinated move, change from traditional systems into much better organized, cleaner systems that also send a signal to our own regional industries. So I welcome again the opportunity to cooperate. I think it flattens the curve of learning, and it's super important. So let's make the most of this and the most for our country members. Thank you very much.
Thank you for flattening the curve of learning statement. I do really like that. And I would like to actually give the last remarks to my colleague Esteban from the Cities Resilience Hub to let us know on the way forward. Esteban, if you could please be brief and concise so that we allow our 80+ participants also to have a nice day and a good evening. Yeah, Esteban, over to you.
Thank you, Katia. Sorry, I don't have a camera because my signal is not so strong.
Okay.
So, yeah, I'm going to be concise. Don't worry. The last three speakers, we were Latin Americans, and I think we talk quite a lot. So, so we have to reduce the time. Basically, I fully agree with Jose Luis' views on the discussions during the afternoon and morning for them. I think that one, I mean, I will just put forward 3 or 4 points that were discussed and I think important to emphasize. One is the public versus private part. Definitely, there are some sectors that cannot be private but have to be public. And this was the lesson learned from COVID-19. I think that health, for example, public health cannot be private. And otherwise you run the problems we have been running until now. The other part is the global versus local and national. Definitely the local level is at the first line of response, as we can see in most of the crisis situations. Therefore, we have to emphasize the importance of decentralizing. And I think that was very much emphasized during the whole discussion. The other part is the opportunity for change. And that means that we shouldn't build back as it was before. So going back to what we've been calling normal shouldn't be the objective. We should build back much better. And now learn the lessons from this COVID-19. The other part that has been very important here is the vulnerable groups, and we should make emphasis in that while, as I said in the other workshop, while we are all confronting the same storm and sailing in the same storm, we are not all on the same boat. Some have more resources, some have different captains, some have different approaches. So I think that it's very important for all of us to be conscious of that not all cities and not all countries are in the same condition to confront this or to respond to this crisis situation. So basically, the other part, and I think that it was very interesting because Diego was the only one who mentioned climate change during the last 3 hours. And I think I fully agree with him. I think we have to recognize that climate change is the main challenge that we are confronting. However, we cannot forget that we have some immediate pressures, and one of them is definitely poverty. If we don't start tackling the issue of inequality, we are not going to advance much more in the agenda. Because as we can see, these crises are disruptions of our potential development. So basically, we have to have a multi-hazard approach. We have to have a multi-stakeholder approach in which not only public and private, but also communities and people are at the center. We have to have a multi-sectoral approach because we can see now that one health problem has carried out so much burden into what's the economy and the social aspect that we cannot only concentrate in one sector. We have to act in a multi-sector approach. And we have to also think in shocks and stresses and how do we start working with them, trying to build resilience. I think that those are the most important areas. I would like to to thank our panelists, our participants for bearing with us during the last hours. I have to strongly thank my team for putting this global workshop together. I'm very happy with the content of this and also the last week. Thanks to Katia for moderating, it has been fantastic. And you have been summarizing each of the discussions, so it has been quite easy for me to summarize at the end. Thanks to Amaya, Anna, Yana, Craig for the task. I think that they have done an excellent work, and I'm very, very happy. And I think that most of the people are happy with the workshop, with the global workshop. Finally, thank our UN colleagues, UNCDF, as well as the regional commissions, because they have put quite a lot of meat into this discussion. And finally, I will just say, we must think long-term while we are fighting this crisis. I don't think that we can just concentrate on the immediate needs at the moment. We have to think, how are we going to get out of this one in the long term? And I think that was the initial potentially mistake of some places where they thought in the health part without thinking in the economic and social aspects. We have to concentrate and try to make sure that we think in all fronts. Sorry if I extended a bit more than expected, but I want to thank you all, and thanks especially my team for pulling out this excellent presentation. Over to you, Katia.
Yeah, thank you very much. And I just wanted my last 3 sentences to highlight the point that all the information, discussions, materials will be uploaded to the City Resilience Hub website in case you are looking for the summary. My colleague Amaya has shared the link to the Global Compendium, which collects case studies, so please feel free to suggest other cities. And I would like to use my last sentence to really thank the translators. Sorry again for the technical challenges in terms of translation, but thanks for spending also overtime with us. I know that is always an issue, and but you see, it was a very inspiring discussion. And then 4 more words. Buenos dias to Latin America, mas salama to the Arab region, au revoir and goodbye to Africa. Looking forward for further engagement. Goodbye.
Thank you. Bye.
Thank you. Bye.
Thanks. Bye.
Thank you very much.